car muffler was great, by the way. Like that purr, what kind of muffler you got on your joint?
AC Schissner.
Okay.
I can't never
So it's
pronounce
German.
it. Yeah.
Okay. What kind of airflow that thing got?
That's all stock. The airflow in the front is stock, but that exhaust is aftermarket AC Schissner. And
yeah, that's a good aftermarket purchase.
I love it.
Yeah, when I get my joint, it's gonna have a muffler like that.
Yeah.
Yeah, like
that's the main reason
I'm not gonna drive a quiet car. I'm not. I know I'm not gonna drive a quiet car. I'm very aware. Like, hey, well, it's not gonna be loud, but it's not gonna be quiet.
I had multiple cars, but most of the 3 cars I've had, they're loud. Well, all my cars have been loud.
Yeah.
Whether it's exhaust or system.
Okay.
Yeah.
Okay. No, I like that. I like that. But yeah. Hey, what's up, guys? It's your boy Juice Jones from Get Home Safe, back with another one. Welcome, homies. Welcome all. I'm here with my boy Trey. Trey, what up?
What's going on, sir? How are you?
I'm good, man. I'm good. How you doing, man? You travel far.
Yeah, man.
Far enough.
I mean, that's my radius.
Yeah, you're not down the road. You're not down the road. Nah, you're not down the road.
That's my radius.
Yeah, by ways of
Caroline County, Virginia.
Okay, cool. Tell me about the county, man. The stars look good on that side.
Yeah, man. Well, it's a rural area, small town down there. It's growing now. It's big. It's getting bigger. People are coming. We're building more houses, but it's a small rural area in Virginia, in between Richmond and Fredericksburg. So, if you know where Kings Dominion is at, that is where Caroline County is at as well. Now, still my hometown. I love it, man.
And book releases.
Yes,
books. You can put the book right there in that camera. Yeah, that's,
here we go.
That right there. Yeah, that's no. That one. Okay. That's right there. More direct. Yeah.
This is my new book I dropped in October. Refresh Journey to Find Peace.
Yeah.
Self-help memoir, co-author with my guy Saint Yvonne, and discussing a lot about things that I went through in life, challenges, grief and loss. My faith, things like that, and. You was down to the book release party?
Yeah.
Good
Pulled up.
experience.
Yeah, great birthday party. Birthday party too. Monty and I, we was talking about it yesterday, and we was like, it felt like it was a birthday party that happened to have books. Because I went to another book release yesterday, so it's like, it just felt like a birthday party that happened to have books, and I was like, all right, so I'm averaging right now 1 birthday party a year with a book release.
Yeah, that's good.
Yeah, that is
good. More authors.
That is black authors.
Yeah.
All right, cool. So tell me about who you are and what it is that you do.
Yeah, man. Well, my name is Gary Trey Taylor, licensed clinical social worker. Depending on where you meet me in my life, you might know me as Gary or Trey. But either way, I am a licensed clinical social worker by trade. Yeah. Therapist, providing therapy to black men and women in the state of Virginia.
By discipline.
Yep. 3-time published author around Refresh Journey to Find Peace, You're Good Fam, and Mental Health Keys. I'm also an assistant professor in the Department of Social Work at Virginia State University.
Okay.
And I'm a consultant, I'm a speaker, facilitator, and car guy, sneakerhead, coffee lover, deacon and young adult leader at my church, and most importantly, my husband and father, two children.
What does your hat rack look like at home? Because you just said so many hats.
Yeah.
You could have been like, I'm a chef too, and I'll be like, oh, the cooking was great.
Yeah, I like cooking. That's very therapeutic for me. I be just throwing stuff together. My wife be like, how did you do that? I was like, I don't know, I just thought about it, saw it, and said, hey, put something together. But my hat rack sometimes gets jumbled.
Okay.
And sometimes it's a mixture of everything at the same time. So I have to be really, really diligent on taking the time to separate and wind down. And so, but yeah, man, that's a little bit about me, man.
Okay. How do you set boundaries between all of these profiles you've created over the years?
It took a long time. I think one of the ways is that I am taking the time to set in that lane that I am, whatever hat that is, and be consistent with that role, right? So I don't try to get too much out of that role. Don't try to overextend. Try to stay consistent in that role. So if I'm like today I'm just free, so I'm just Trey today, right? I'm just kicking it with my man, it's my homeboy. We just talking this stuff. We talking.
Just broke some bread.
Yeah, broke some bread, some amazing wings,
and burgers.
I'm gonna check them out.
Fries. Yeah,
because I usually come up here.
Yeah,
and I go to what's the other burger spot I always go to? Shake Shack.
Shake Shack.
That's my spot.
Yeah, over by my spot.
Yeah, but now I gotta.
Yeah. We're not gonna shout that out. No free advertising.
No free advertising.
Nah.
Cool.
We don't even know if it's a ghost truck or a real restaurant though. Oh. That's the thing, you feel what I'm saying? And when it comes to those spots, it's like, there's a lot of controversy around those kind of places.
Like, for real.
It's a Ghost Burger. I don't know. But that thing slap.
Give me like
this slap.
Gives me like Pac-Man vibes. Like
it's slap. Yeah. So I just,
okay, yeah. So so when separating that role, so like I try to be real intentional when I'm in those roles. So like when I'm in that, right, when I'm therapist, I'm a therapist for this hour.
Yeah.
Take time, get out of that transition. I'm a husband and dad. I don't want to have nothing to do with being a therapist or whatever at this time when I'm being a husband and dad.
Yeah.
So that's the way I had to separate them in order to be able to maintain them. And then also understanding like your role is your role in that. Don't overextend. Take your breaks, take your time when you transition in and out. So if I'm coming from the commuting down the road, I'm not just going to jump into like, housework or, whatever. I'm going to take 30 minutes, 40 minutes to myself.
Yeah, decompress,
gather myself. And then now I'm on, okay, what we need to do around the house? I'm husband, I'm daddy, things like that. So I had to really be diligent and intentional about that, especially starting with my first child.
Okay.
She'd be 7 in October, so it's been a while.
Congratulations. Bundle of joy and energy right there.
No, it's the 1-year-old. It's the 1-year-old.
Yeah, it's just...
It's the 1-year-old.
Still more sleepless nights.
It's the 1-year-old. He is nuts, man. But he's me.
He breaking into rooms yet just to like sleep between everybody? Like how's he moving right now?
Terrorizing.
Okay.
Terrorizing. Like just into everything. Throwing, he got a good grip. He can throw stuff. He's strong. He can move stuff.
He's not into the terrible 2 state yet, though, right?
I don't know. I think it's early. He get angry. If you do something, tell him to do something. He get mad. He'll walk. Walk. And then come back around and say, "Pick me up."
Oh, that's funny. That's funny.
He's wild, man. He's wild. That's my guy, man.
How do you balance owning and running a private practice while being a teacher at a university?
Oh, goodness gracious.
Yeah.
That balance has been one of the things that has made me say I'm gonna have to make a decision. Okay. To where I'm gonna have to phase out my private practice and business because one, it's a lot of demand. One thing I tell like a lot of times with social work student interns or just therapists in general, when you talk about business and running a private practice, especially solo practitioner, the business hat and the psychotherapist hat, most of the time they don't see eye to eye. They clash a lot. Yeah. And so you have to figure out a balance in between that to make that work. Not even talking about the other hats, your personal self, and then just throw in teaching. And when I started teaching, again, it came up out of nowhere, just had an opportunity and I was doing it and I was like, okay.
You earned that opportunity.
I did earn it. I did. But it came up like just because of my entrepreneurship in a sense.
Because of your hard work.
Yes.
Yeah. Sure. You're going to get this credit.
I appreciate it. I appreciate it. I do. And, but the balance, right? Because I would, be on campus and then go to sessions or I'm doing sessions in my office and then get on the road, come home, family, church, whatever. Son, my mom and dad, so like it was a lot. Yeah. So where was time for me to kind of decompress and set myself down and
mom and dad are close, so you're juggling a lot of relationships as you're doing this too.
Yeah. Exactly. And so that's been tough. And it can be done. I think it can be really done. It's just you're going to have help. Whether that's a biller or somebody working with you to kind of help that business continue to thrive. But it's a demand. It's a high demand. You're dealing with teaching with students, 3 hours or how much time, then also doing your practice and doing business. So you got to switch between teacher role therapist role, business role, all the time.
Vernacular changes.
Vernacular.
Your body language.
Yeah. So that can be taxing. So I felt it. I got sick twice.
From overworking, overexertion?
I think it was overworking and stress.
Yeah.
And that first semester, that teaches last January. And I got COVID after the first class. And then ended up getting strep at the end of the semester. And I don't wish strep on anybody at all ever in life. Strep was one of the worst things I ever had in my life.
Especially with your son's first year. That's nerve-wracking.
Yeah. So I had strep but I was like, I don't even get sick like this. I got sinuses and allergies. And I said, man, you know what? I might have to, make a decision. Yeah. And so and I thought about it, went on vacation, really listened to my body.
Planned family vacation,
yes.
Yeah.
And just say, okay, well, is this reactionary or this is something that I need to go ahead and let go of? And I had that week off, chilling with family, just existing, and that's the decision I made. It's like, I'm gonna go ahead and phase it out.
Yeah.
I've done 3 years with it.
You've done 3 blessing years with it.
Yeah. So, and my people got better. So I think that it's a good point in time to go ahead and just phase it on out.
Are you gonna suggest new therapists for your people to go to, or let them lead their newer relationships when it comes to these new therapists in their lives?
Yes, I'm doing both. I'm gonna help them, give them a list of folks that I think they'll be a good fit.
Yeah.
And then also I'm let them decide, like, hey, I want to make sure you don't have no break in between, September and October.
Yeah.
But I'm gonna give you a list, and some of them like, okay, I'm gonna go ahead, I need one. Just keep maintenance. And some are like, I want to just take a break and see where I lead at. Just give me the list, give me my records, and I'll go from there.
Does it ever feel risky when your clients decide to take a break?
What you mean?
Like, so being a therapist isn't the same as being a parent, right? You've done all this work, but with doing all this work and understanding your clients and who's who, sometimes there's certain clients that it's like, we've done a good amount of work, but I'm not sure if you're out of the forest yet.
Oh, okay. Some of it, yeah. Some are a little bit risky, but I also have faith in them that they will get it together or they will reach out. And that's evident by some saying like, oh no, I already got somebody set up.
Yeah, they're early. They're early with
like,
it.
Okay, are you good?
Yeah.
I'm gonna take what we learned and talk about.
So you've had talks with all of them separately about the new direction and what's gonna happen.
I started that either last month. Last month, early August.
Okay.
To prepare them. No, I started last month, July.
Yeah.
And just started preparing them for that.
To be fair.
Yeah.
Yeah. Are they still gonna have a relationship with you?
Probably so. And at some point, I told them, hey, you always can reach out, let me know about progress. The email will still be available, but I just won't be in session. So yeah, I want to make sure that they still have a connection, that this shows that I just didn't discard you. Yeah. A lot of these guys are first time in session, therapy.
So you were there first for a lot of people.
Some of them are there first, yeah.
Okay.
And so I want to make sure that is consistent. And then, as we go forward, things might change, but I just want to make sure that they have support and know that they can, do that.
As a therapist, would you say it's scary when you have your first time clients compared to, I've done work with you before and we're working again?
What you mean scary?
Like, you don't know what could come of your client. Like, when people reach out to you, they may say it's this topic, but you as the therapist, you'll sit in the session, you're like, actually, it's this topic.
Oh, yeah. That has happened. I was like, oh, man, it's going to be different.
Yeah.
Oh, wow. Yeah, no, that's happened. And I think that with that, I try to, meet them where they are at. It depends on how deep we in sessions. How many we've done, where if I want to say, well, I'm going to shift this to this, because this is probably the most personal thing, or most thing I see is a issue. But at the same time, if they're not ready for that, I got to go with what they, want to do. Secondly, sometimes I've made the mistake of working on something that I think is more prevalent or is more pressing, but that's not the thing that they want to work on. Yeah. And it gets the signals get mixed and crossed. So you say you came in for this, but you're pressing this. And I think that needs to be addressed. I'm going to lean on that, but you said you want to work on that.
Yeah.
And then it gets crossed. So,
okay.
Yeah. I'm not a perfect therapist at all.
I think it'd be, if you were perfect, we probably wouldn't have met.
Right.
Or it would have made sense. I'd have been like, nah, man, you a little bit too buttoned up. That's just the most polite way to put it.
Me being buttoned up is not one thing that you never see together.
Just, your button's a little bit too tight. When it comes to the world of the work that you do, what are 3 values that you've moved forward with in terms of your patience?
Ooh, goodness gracious. Patience is still a thing I work on. I'm not the most patient person at times. I'm just not. And that's something I'm always going to be continuing to work on, I know. Because I like things done a certain way. And I like things done on a way that makes sense. Right? Yeah. And I'm a person that likes to agitate and change and create and fix. And if it's not a certain way, then I get upset. So, but with that, I've learned to practice patience in a way that says, hey, it doesn't always have to be perfect. Right? It doesn't always have to be perfect. Also, hey, you've done this from the ground up. I need you to be more present with what you have accomplished versus what you're trying to seek to accomplish. And lastly, sun gotta come back up Sunday.
Yeah.
So it might not be right now where you want it now was urgent, but sun gotta go down, sun gotta come back up the next day.
Would you say you've had a better relationship with imposter syndrome because you've accomplished so much, or is there still a part that's like, I have more to prove to myself?
Good question. Oh, that's a good question. Juice is a very good question. I love these questions. Man, and this is why I wanted to get back on more positive guests. I'm tired of asking questions. I want people to ask me questions. Man, that question came up, actually, about that, how you deal with imposter syndrome going into the academic space. And I told him, I said, of course nerves is there, but, your environment makes sense. So I get on campus, right, and I'm supported and surrounded by nothing but black professionals, black excellence.
In the mental health space.
In the mental health space.
Within that 4%. Because the number is still 4%, right?
Yeah, it's like 4%, still 4%.
That's crazy.
Right? And with doctors. And I'm just like, oh, this is fire. Like, and then, but in that, man, I think with entrepreneurship, some things, even though I still got my patience is always a work in progress, it's some things I'm not gonna let get to me as much, because I was saying in my training I did last week, you have never had to figure out how you're going to pay business expenses and personal expenses because a check has been held up, or funds have been tied up for whatever reason. That's a critical thinking skill or a patience level skill that you just can't get that on the fly. Right, you don't get that.
Just as important, understanding if your business makes below a certain amount, maybe you don't need to be running a business.
Right. And
maybe you may need to be a community person. So like, for example, I've done the hoodies, the shirts, everything else. But my number was always like a little bit under 5,000. Right. And I was like, well, a lot of these companies that you reach out to get your stuff done, no one's asking for your tax number. That means that you make below a certain amount where your tax number doesn't have to be involved. So you may want to just do business with these 2 people. Your cousin that does your taxes, let them know, hey, this is business, but it was just done on the credit card, because it's not like we're making a bunch of money and that's where the money went back to. Right. And however that looks on the taxes, since you file all your taxes together, just do it that way, since you always keep it below a certain amount. Because remember, the brand that I built, the information is more important than the clothing. The clothing just happens to be there. So by the middle of October, my clothing is going to be sold in DC and New York. Which is dope, because that's like, you're expanding, but you're still selling a limited amount of clothing and money being made. Because at the end of the day, what they do on your taxes is, how much did you pay to get the stuff done? That gets deducted. All right, how much did you make? All All right, how much was that tax? That gets deducted. All right, how much did you make in profit?
Right.
All right, do you have a number of that? Cool. That gets deducted. How much did travel cost? Oh, you travel back and forth to New York, DC, all these places, do events. That gets deducted. Oh, well, it looks like you only owe $4 and some change because you haven't made any money in profit. That's big money. Because most of that is production money, especially when you spend all this money on all these new cameras and everything else.
That's expense.
Including your cell phone.
Right.
So when you look here, this is about a little bit under $6,000 worth of equipment, and that's not including the audio or the lights.
Right.
But like you set it up and they see where the investments is going. So even if you get investigated, it's like, nah, he spent the money on the stuff.
Yeah, exactly.
Yeah.
So yeah, I mean that definitely is a piece of that. It's understanding.
I say that to say not everyone has to have a business.
True. But see, everybody like it's different varying levels of business.
Yeah.
Like, you know what I'm saying? You can be self-employed, entrepreneurship fully. You know, you could be entrepreneurship where you're still working 9 to 5 but got the side hustle on the side. You know what I'm saying? Or you can contract yourself out.
Yeah.
You got to figure out what's best for you though. You know what I'm saying? And so I can honestly say if stuff go left, I know I can be self-employed. That's one of my goals I've always had. I've done it. You know, things have shifted and changed with my family and stuff like that. So I had to make a little bit different decision and pivot. But if it go left,
the skill set's the skill set.
I can jump back. I don't have no problem going back. We'll figure it out, you know, and we can do it a better way.
Yeah.
So, and it's my second business, really. My first business was working on cars, like custom cars, stuff like that. So now, you know, just get that learning opportunity. And so
the third one's gonna be coffee.
Third one's gonna be coffee.
Yeah, third one's gonna be coffee.
Yeah, absolutely.
Yeah.
So
then the fourth one's gonna be reseller of stuff.
We'll see.
Yeah,
we'll see
if you have enough storage space.
We'll
for that.
see.
Yeah.
But yeah, that's where it's been at, man. Just trying to, you know, you gotta be knowledgeable about that. I did pretty good in private practice. I was getting trending up to 6 figures.
Yeah. But then you saw the sacrifice that would come with trending in that direction.
Well,
according to what you had though,
I was trending 6 figures. The only reason they got cut was because my son got born.
That would have taken away.
Yeah, that would have taken away. So that's the only. But so I was like, okay, I know I can. It's like you know, and I made some mistakes along the way. You know what I'm saying? We got to talk about business taxes here. Taxes, you can't run away from taxes.
You can't.
But it's just, you know, and then having an office space, letting that go, it was too expensive. You know, just learning on the fly and not having a template. And so that kind of circling back to that question around imposter syndrome, it just reinforced like, brother, you can do what you want to do. You just got to put your time and effort to it. And which kind of got me back into working out again because I got complacent with that.
Man, you see, I've been sore the whole interview.
Yeah.
You can tell when your boy's sore, he's just moving around a little bit.
He's like, ooh, that's this little too
like,
tight.
ooh, that thing tight. All right, cool.
Hit home too much.
Yeah.
But I was like, man, bro, if you put, and I've always said this, but I was like, boy, if you put in the time and the effort and energy as much as you do of the work that you do, you could easily get back into shape or stay in the gym, be healthy. You can do that. You know what you're doing. And so me personally, I know too also, I like a challenge.
Yeah.
And so for me, business and running that and figuring out was a challenge to let me know I can do it. I'm capable. And now it's just like, okay, well, I can figure it out. And so I think for me, imposter syndrome at this point has been diminished to the point where it's like, why not me?
Okay. What do you not like?
About what?
You just said what it is that you like. You know what you like. Now, what is it that you don't like? If that's not a clear question, I could clean it up for you.
Clarify.
All right, so we know about me doing pro trials from like 2011 till about 2017. Right? NFL, CFL, AFL. In that time, one of my workout partners for the last 3 years, while I was trying to go pro, was a strongman by the name of Howard Battle. He was ranked like 120 in the nation at one point when we was working out together. So the reason I bring this up is been back in the gym. Whole pandemic, I was off. Right? Pandemic, all right, you know, I gotta live. I want to see what it's like. I deserve a break. Worked hard enough, right?
Right.
I've been training since I was like a fat kid, 11, 12, in the gym, right? Till about 2020. I forgot how old I was, but let's just say 2020. So then met this guy. He was like, yeah, I'm planning on working for strongman competitions. I'm like, all right, cool. I need a partner that gives me a reason to be in the gym 3 hours a day, because my day in the gym is like 3 hours. When I show up, it's 3 hours, no matter what.
Wow.
Right? So right now I'm at 3 days, 3 hours. My goal is to get to 4 days, 3 hours, and that'll be like optimal ground to get stuff done. That includes stretching, warming up, working out, core lifts, be in the sauna, 20, 30 minutes. That's it.
Nice. Okay.
You feel what I'm saying? You might mix a sandwich in there depending on the kind of day you got going on, right?
Gotcha.
Leg day, gotta have a sandwich.
Yeah.
So I asked him, what do you plan on doing? He's like, strongman competition, blah, blah, blah. I'm like, all right, cool, man. So what you work on today? He said, I just hit a little arms, this, that, and the third. I said, okay. So what you doing tomorrow? He said, I'm not sure yet. I said, what you mean you're not sure yet? You getting ready for a competition. He's like, but I think if I get a coach, it'll be expensive. Be expensive? Do you want the thing or do you not want the thing? I could feel not my competitive side coming out, but my just simply organizational side coming out.
Yeah.
When people say they want to be a thing, they don't acknowledge all the steps and habits you have to have built up before you become the thing.
Right.
What's your diet like? Do you have a good diet? What time do you eat? What's your warm up before a workout like? Why do you warm up that way? What are you looking to activate before the warm up? What are you working on? Why do the workouts? Why are they shaped that way? What is the goal? Are you looking at the German method or the Russian method? What are you looking to accomplish? How strong do you want to be? Have you done research on the competition? Have you done research on the people you're going to be competing against? Do you know what competitions they've been in? That's just for me working out with my partner and paying attention to how he conducted himself.
Right.
So when I meet this young man and he is not any of those things, I'm just like, all right, let me hear more about you. He tells me, well, I got a wedding in the beginning of September. I said, when's your strongman competition? It's November. I said, why do you have a wedding so close to your strongman competition? Right. If I'm getting ready for my wedding, I don't give a damn about the world. I'm going to drink, I'm going to eat, I'm going to have fun, I'm going to do all the things.
Exactly.
He said, oh man, it's just, and I was like, and you got to fit your suit. So you can't become the actual size of people that do strong men things.
Because you
literally have an emotional and a mental block on the thing that you say you want to be.
Yeah.
Next day, which is yesterday, I show up, work out with him. I was like, all right, what are you working on? He's like, all right, man, I'm just doing this workout that I got from a couple of years ago. This dude who's a bodybuilder. Stop.
Yeah.
Bodybuilders, powerlifters, strongmen, they all train differently. It's on purpose. Bodybuilders are meant to be strong. They're meant to be as aesthetically pleasing as possible.
Right.
Powerlifters, they have 3 lifts that they need to focus on, and all their things rotate around that. Yeah. Squat, deadlift, bench. Strongmen, me strong, me pick up, me put down. That's it. That's you're building your body to be and do that.
Right.
And I realized the day 2, I was like, look, I'm going to sit down with my homie who runs the establishment you work at, and we're going to be like, look, you have an issue. We're going to get you together. If you don't listen to our suggestions, you and I can't work out. Because whether I'm working towards a competition or not, I'm not going to watch you fraudulently throw this opportunity away and be cool with it. Yeah. Because I'm not that kind of friend. So I know what I don't like. That's why I was like, I heard what you like. What do you not like when it comes to the profession and what it is that you do?
Oh, okay.
You like that?
I like that. I like where you took me. I was like, okay, where's where we're going? Okay. What I don't like about the profession, I don't like at times that we have to fight for equal pay. As far as the services that we provide as licensed professionals, and we have to prove it to somebody that's not licensed professional. Yeah, I think that makes a shortcoming for the client's treatment, and then kind of burns out therapists. We talked about it earlier. I think that with the healthcare field and how we perceive ourselves as experts, we set ourselves up for burnout because we think we should have it all together. We should have all this knowledge down. We should know this intervention. We know this change. We should know this agency. We need to be this way in session. We need to be that way in session. We take on that and have all this immense pressure on ourselves to provide and help people, throughout what they need to work through. Yeah. But it's trying to be perfect, and therapy's not perfect. It's not a place where perfectionism exists.
Yeah.
And so that's kind of embedded sometimes into the profession of what we do, especially in the mental health arena, but also in the therapy arena. Like we should be, perfect. And I've seen it a lot. It's one of the reasons why I had to get out some of the therapy groups and Facebook, stuff like that, where people will just nitpick certain ways on how you do stuff and then make you feel like you don't know what you're doing. And that's where the imposter syndrome was slipping.
Yeah.
And so I don't like those type of things. And I also don't like the limiting avenues on what we say would be helpful for somebody, especially black men.
Yeah.
Right. You know what I'm saying? I think that we should look outside of the box avenues and strategies to help black men in a way that makes sense for us, that reads to us, right? And even black people in general, like we should be able to embrace those interventions and things, get reimbursed for it to do just that. Versus,
and that's a very important point, getting reimbursed for it.
Yeah, getting reimbursed for it. Why does it? One of the biggest things that I really struggle with is that when we start talking about doing preventative work, whether that be something like Get Home Safe, something like a barbershop group, something
Which
like
is large preventative work.
Right. Very, very much preventative work.
Yeah.
Something like the Goodfellas Project, where we're providing space and support for black men. I find it I really get upset when there is limited funding for preventative efforts. Okay, we want to do one and see where it goes. But if you know mental health, strategies in that piece, one-off is not the best thing. It has to happen consistently.
One-offs don't exist.
Right.
It takes 3 to 4 years to see the results of the work that we've done.
Exactly.
And at the end of 3 to 4 years is technically day one of proof. And now you figure out, okay, this is what we do.
Precisely. Yeah. Exactly. And so I've ran into some situations where we're providing support for men in whatever capacity, whether it be in student capacity, whether it be in community capacity, whether it be in, academic capacity. And I've always got the response back, we want to do, the funding is limited, but we want to see it for, see how it goes first. And I get livid because I know, especially for black men, that one session can make or break, but it has to be multiple. Yeah. And it could take 1, 2, 3 years, right? And so I've seen it at all levels. Community, within the agencies, healthcare agencies, academic settings, right? Where we're going to, give you this limited amount for this one time only or 2 times only, and then that's it. And then, okay, we'll take it from here, or it didn't produce what we thought it would. It wouldn't produce what we thought it would because you have a limited scope on how you see those results. And again, that goes back to the field of healthcare and mental health, where we only react. We don't prevent. Or
as our young associate that you and I, Marquise, know, if we keeping it a beam, what we've made isn't in the shape or form that they want it to be.
Exactly.
So one-off is an excuse of, hey, see, look, we helped them and see what they didn't do. This is why we should do it our way.
Yeah, it's perspective.
Yeah. And with stuff like that, honestly, I think being an early adapter of whether they pay me or not, I was going to do this regardless. So like you offering me money and telling me, well, if you do it this way, we got you. Why should I change what's working in the community if it's for the community? Exactly. It's tailored for the community. Like me sitting on the phone with a man who doesn't know me from a can of paint in Michigan, Flint, Michigan, and him saying, hey man, I really appreciate your advice. Like to talk to you more. My camera just got really hot. It's shutting down. Oh, okay. It's shutting down correctly.
Transformer.
And that's why we got another camera right here to keep it moving.
Like, nope. That's what I was like. Absolutely not, sir.
That's why you always keep the camera running. There we go. That's good right there. That's good right there.
I'll take
that's why that thing about to shut down too. But the people, they reach out because we've made a difference. They reach out because they see that we've done something that they either want to be a part of or they want that for their own community. And that says a lot. Like you you've probably had people hit you up about, hey man, can I get advice? I see you do this, that, and the third. What does that look like in my community? Yeah. And I tell folks like, hey, we can't tell you how it looks like in your community. That's your community. Yeah. I can tell you how it's worked here and what my concerns were and what I looked out for. But like, you need to understand, it's going to take you time to become the thing you want to be, which means you're going to have to doubt yourself. You're going to have to correct yourself. And you may need to change out the friends that do work with you on a professional level when it comes to this stuff. Yeah. So you start to recognize who you are and who you're not. Yeah. And then that's where you go from. I've gotten that question a lot. And I've been trying to work better on giving a better, more clear connection or a clear answer on, you know, how to get to those points. Yeah. But I take issue, like I said earlier, where context, right? And I've also understood that everybody's not like me and how I approach things. Yeah. So it's hard for me to explain at times, you know, as far as how to go about doing it. I could tell you how I went about doing it, but I was grinding. And I don't really want that for you because I don't know if you know, built that way or if you do things that way. I want you to do things your way. Right, that makes sense for you because how I did it might not be, well, one, it probably wasn't the healthiest, but two, it might not make sense for you. Yeah. But three, so what I've been trying to do is point out the potential pitfalls. Like, okay, this is what I dealt with, and you watch out for that because they're not going to tell you about that. Right. You know, one of the things I tell students when they come into the field of social work is I need you to understand that, you know, you're going to go into agencies that do not practice or abide by the NASW, which is our guiding practice, our code of ethics, this thing that we live by as social workers. The big book. The big book, right? Yeah. You're going to work for agencies that don't abide by that. Yeah. You're going to also work for agencies that might not have the same missions and values that you have or core beliefs that you have. How do you continue to work within those systems of which you might have the same beliefs as? Yeah. You know? They're not going to tell you that in class or, you know, in the exam and things like that, you know. So I've shifted my thought pattern. People ask me about that. I try to point out the potential pitfalls that I've dealt with versus showing or telling how I went through it. Right. You know, I've done it in my book. I have that. But again, mindset might be different. Mindset defines everything. Yeah. Quite honestly. My mindset is crazy sometimes. Yeah. But you need that. You need that crazy. You need that edge. You need that amount of energy and execution. Right. It doesn't make sense to them. They never been there. They never imagined it. You feel what I'm saying? My mindset is super disciplined at times. And then it can be super not disciplined but still get the same results. Yeah. You know, so I learned that with like certain friends around me where I'm just like, okay, I want them, I can see the greatness in them and how good they are. And I'm like, you should be doing this, you should be doing, I'm on the top of them. And I was like, you know, it's not yielding the same results. They're not seeing it the same way I see it. Yeah. And they're not me. So let me fall back. Yo, check this out. One might want to think about that and keep it moving. You know, so yeah. I mean, I'm one of those friends. Right. Say, hey man, be a therapist, and I was like, no. Yeah. Be a social worker. Come on, be a social worker. Like, no. And like, you know, I have a valid reason for it. It's I'm not willing to take the time out of my personal life when I'm already making a difference in people's lives. Makes sense. Yeah. To go back to school, to come up with money to pay for school, to be in a program, be in a focus, and give 3 years to be what I technically already am or close to. Because you get the degree to become the thing, but if you've already become the thing or you're already accomplishing what the goals are, which is to help people, what does having the degree or saying I'm the thing change from the work that I plan on doing? Because this is the focus of the work. Right. That's my gripe right now with going to get a doctorate. Yeah. But I'm still leaning. But that's what... If I get a doctorate, or if you were to get a doctorate, I usually say, after I get this doctorate, what new opportunity or money does this pay me for what I've paid for? Right. And we're not even talking about you have to be good on the GRE, and I've never been a good test taker on the GRE. Well, let me tell you this. We don't have to take a GRE in social work. Really? And we got an online program at Virginia State University. I see your opinion. I see where this is going. I see the steps that you're taking. Oh, it's so easy. I was going to say, they got a scholarship for your boy? We can find one. For me? Yes, absolutely. Online courses?
Look, don't worry about that. Take care.
I got to ask all the right questions. I say it to everybody's face. They know what it is. I'm always going to ask the right questions.
We can figure that out.
Okay, all right. Hey, you send an email, and if it looks right, I'll be like, I have to talk to my partner about this.
Yes.
Right?
Exactly.
Yeah.
Let me talk to my...
Like a real adult. I need to talk to my partner about this,
I need an adult.
Yeah, because we in this together. So she needs to know what's going on. Hey, I have this thing. I want your thoughts.
I'm messing with you. But that's, I feel you, and that's my kind of gripe with doctorate. And I had that conversation with my colleagues. I got doctorate friends, and they're like, well, Trey, like, you doing everything that you would probably do after the doctorate. So it's like,
speaking engagements.
Yeah, you're doing everything. I said, well, I understand that. I said, but I think there's another level. There's another level to unlock, and I'm just...
You need to plan that other level out, buddy. I'm just it doesn't sound cool, right?
Right.
But like really, really think about this, right? So you have a grad, a master's, undergrad, grad. Doctorate is the only level you could really go up to. There's no level above doctorate, right?
No.
What do doctors do differently from what you're doing now?
What the doctors do?
Yeah.
Not much difference. Not much difference aside research with that.
You've already done research, right?
In a sense.
You could do research without a doctor,
I can do
right?
Research with them, yes.
You have research friends. I know you have research friends.
Absolutely.
We've talked about them, right? And you don't need them to be analytical because you're already a very analytical person. Like I've heard you drop numbers in convos, right? So what value does having a doctorate bring you outside of your pride or your goals? Does it open a new door? We get the paperwork to open new doors. And those new doors better be singing songs like I Can Show You the World from Aladdin.
Yeah.
So
so two things. One, it legitimizes. Yeah. Right. And
the legitimate person that made a difference to the community already?
Yeah, but it's just icing on the cake. Okay. So like I don't want a regular yellow cake. I want icing on it too, right? Yeah. So
don't drop that yellow cake.
And don't drop the yellow cake.
Yeah.
Put some icing on that. Yeah. Right? You know what I'm saying? But also too, here's the thing. I envision national change around access to mental health.
Okay.
National change around national access to mental health for Black community and Black men, right? On a national and state level.
Yeah.
I could probably do that definitely here at this level if I continue to grind and, network and meet my resources. But I want to say, by the time I leave this earth, that I affected change at the highest level possible and maximize it at the highest effort I can academically, community, everything. That is what it is, right? And the vision never changes.
Yeah.
So my next goal, I think because you asked me this earlier, my next goal is federal and state.
Okay. So after the 5 years, that's the next goal.
Yeah.
I didn't want to touch that one yet. I was like, I feel like it's too fresh and you get into your academic stride. But and we've talked about this before. Right. We've talked about this before and why that needs to change.
Yeah. Ain't nobody up there looking like us.
Yeah.
Ain't nobody up there that understands the mental health.
Ain't nobody up there thinking like us.
Yeah.
Yeah.
So nobody can speak to community, clinical, policy related in that capacity.
Unless it's in a book.
That's in the book, and the book could be wrong sometimes. So I don't know how long I'll be in academia, for real. I mean, I have committed to 5, at least. Yeah. And my leadership know that. I've also accepted the opportunity I might be there until I retire, right? Because I do enjoy the space. But I do know that the next goal is state and federal policy legislation, which is something I've been wanting to do since getting my MSW.
And I'm gonna have to pull up to you after 5 years, like, open up.
Right.
Yeah, now open up. You said 5 years. Your time is up.
It depends on where
pick you up.
Depends on where it's at.
Okay.
Depends on where it's at. Depends on where this program is at. Because I want to make sure this program is built in a way that makes safe and sustainable Black social workers. So that's my first priority.
Yeah.
But my long-term priority,
Okay.
is I'm trying to get to the highest level to affect change. And when that affect change and things happen on there, I'm gonna ride out to the sunset. I'm gonna go into my coffee shop. Don't ask me nothing else about social work, mental health, anything.
Coffee.
It's coffee.
Coffee.
And that's a limited. I'm not talking about doing mental health and social work in my 50s and 60s. No.
Yeah.
No.
I did the work for you guys. I'll be chilling over here sipping my coffee.
I am going to do my best to do it at the highest level. I'm going to leave the template. I'm going to hopefully set up the future so they can take it, build what we've done, and run with it.
The goal is to be able to become the comfortable consumer who sees that the world has changed and the cup of coffee tastes better than it did 20 to 30 to 50 years ago.
And getting the funding that's needed for these programs that Biden's office doing. How are you going to meet the demand for the professionals?
Correct.
To do it, because this is not easy work.
Yeah.
And to find a licensed professional, to create a licensed professional from start to finish, fully licensed, not restricted.
Yep.
7 to 10 years.
Not restricted.
Not restricted.
7 to 10 years.
Not restricted.
That's the equivalent of going to high school and college.
Yeah. Not restricted. I mean, talking about not restricted meaning they can practice independently and bill independently and do what they work to independently with their license.
Yeah.
You know what I'm saying? If not, they're gonna be under somebody. They gotta get a sign off on. They gotta get their hours, things like that.
Yeah.
So that's my other gripe with just mental health policy, and that's why I want to get to that higher level to affect change. Because I need y'all making policies, y'all throwing money at these places. They threw money at the opioid epidemic, right? But they didn't throw money at the mental health support for opioid epidemic. Here's why we still have an issue today.
Yeah. There was never any support for the people recovering.
Yeah. They were just, here's the,
we gave you guys money. I don't see what the issue is.
We gave you this drug to use.
They're giving money to the same companies that made the mistakes.
Exactly.
So imagine getting paid for your mistake.
I wish.
You're never going to change your mistake.
Yeah.
You're just going to sit on and be like, we changed the mistake by stopping making the drug. And it's like, that's not change.
You created the monster.
Yeah. You saw they came out with the whole opioid thing on Netflix this past weekend.
I've been hearing some stuff about that.
Yeah, it's out there.
I heard it's good.
Yeah, I'm not watching it yet.
I heard it. That's the painkiller one?
Yeah.
I heard it's good.
Yeah, it's there. It's out.
Yeah.
It's out. It's out and about. That's gonna be a hard watch, man. That's gonna be a hard watch.
Yes.
Because there's so many ways that plays out in different people's lives. And it's like, a lot of people are very private about a lot of their family stuff and what they've gone through. And when it comes to these episodes, you just don't know whose family are really affected directly by these decisions.
Exactly.
Yeah. And you don't ever find out until years later, so.
That area of population is a tough population to definitely engage and work with. And that's why it's super, I think, important that they have mental health support. Because of that, family traumas and things like that, trauma they may have went through, things like that to support them in that. And that's where I want to end up at. I want to end up on that federal state policy side, changing policies around mental health access to care and what that looks like, and then I'll be satisfied.
What if you end up on that side and you realize in order to get a decision made, it's 15 years from one decision?
I'm gonna make sure it ain't gonna be 15 years.
The hardest thing when it comes to policy and politics is getting the room on your side, or at least getting them to understand why it's a need for this.
Right. Nah, true.
Yeah, that's where I think the real this is gonna be a handicap for a lot of people, my bad, comes from.
Well,
nice sneakers, by the way, man.
Appreciate you.
Yeah.
Well then, Juice, if I gotta run for office, I run for office.
I do what you gotta do, man. I ain't gonna stop you. I ain't gonna stop you.
I'll run for office too, man. But I got a small window I'm going to do this with, and then it's gonna shut down.
Okay. Now, speaking of stop, is there such thing as prevention when it comes to suicidal ideations? What does prevention look like? Loaded. Very loaded
You
question.
be hitting me some loaded questions all day. But
loaded questions, man.
Well, prevention is political. So
okay, tell me more.
Prevention is political in the sense of that we always want to say we don't want to talk politics and involve politics in our conversation, but politics.
But everything is politics.
Everything is
politics. Everything.
The taxes you pay, how much you pay for this space right here, whatever. It's political.
It's all politics.
Yeah. So when we start talking about suicide prevention, you have to look at the economy. You have to look at wages, livable income, housing, affordability of quality of life.
Yeah. Keep talking.
Access to health care, access to mental health care, right? These things, I think, are all fuel into suicide prevention. And suicide prevention, tapping in with my public health folks, is a public health issue.
Yeah.
So it's a public health issue. It's not just symptomology.
Yeah. What's symptomology?
Just like this basic level of symptoms that would come about from a mental health condition or a physical health condition. You know, where we would just work specifically with that symptom. So if I'm depressed, I'm gonna work with depressive symptoms, and this intervention works for depressive symptoms, right? Yeah. If I'm suicidal, I have thoughts about wanting to harm myself, how can I work with those symptoms of suicide? You know, things like that.
So, in your work, are you currently doing suicide prevention, or what is your work currently?
So right now, I would say no. Well, no, I take that back. I would say I do it in a fashion that is more community oriented.
I was gonna disagree with you, but keep going.
More community oriented when I do certain facilitation efforts to help work with men, and making sure that they have a space to be heard and seen and felt. And then also, like, you know, of course, I provide individual therapy as well, so that's another space. But those are more spaces that I do suicide prevention in the sense of clinical space, individual therapy, and then community-based kind of outreach support group status for men and stuff.
Do you think that there can be a better execution of outreach and group work when it comes to mental health?
Yes.
How so? Give me an example of what you've seen and how it can be done better.
We just have to be more intentional about what the population that we're working with, right? And we have to fund it. Yeah. It can't just be a one-off. We've been talking about that. We have to understand how long things may have to take to get somebody to change. How long it may take for somebody to open up. How long it may take for somebody to be comfortable with coming to that space, right? Yeah. And so we have to also think outside of the box that doesn't involve traditional interventions or traditional evidence-based strategies that we have shown to be, okay, well, this has been working since such and such time, right? But this might not be the case for, and I'll use black men specifically, that might not work for black brothers. Yeah. You know what I'm saying? So
this is no longer the land before time.
So what can we do to help, brothers heal that meets the need, and then also, fund that. Yeah. Fund that, and then make sure that we are addressing it. It doesn't always have to be by the book. That's the thing.
I feel like we've brought this book subject up like 5 to 6 different times.
I feel like I built my whole entity, my brand, my business around not being by the book. Yeah. Because the practice is built upon, saying not non-traditional ways to engage black men into therapy who once they said did not go to therapy, but they do to go to therapy. They just need a safe space to be there. Yeah. Right? In a pandemic, virtually, all these things that was just, why would you start a business in a private practice doing that in this time? It's not by the book.
Yeah, but when you look back at it, why not?
Yeah. Yeah. Exactly.
So it's Suicide Prevention Month coming up for September. And I think I may have a gripe with the community of suicide prevention. Okay. And it's going to be a very unpopular opinion. Okay. Right? Why do we advertise all the work techniques and interviews in September when there's 10 more months that this topic isn't getting attention? I say this because this actually is going to come up in a couple of interviews. Like, Black people aren't February. We're February and June. Right. Right. Gay folks aren't just June. Right. So I have like a whole month of content that's going to be dedicated to folks who are gay, trans, other, that are going to be talking on mental health because we've helped them, and that's a demographic of my community that I would like for their voices to be heard correctly and succinctly, like concise with what they're saying and why they're saying it.
Right.
And when I look at a lot of suicide has been a topic heavy for a while now, not just coming out of the pandemic. It was an issue way before the pandemic. Mm-hmm. And now that a lot of children are getting involved, I feel like there's always the rush to hire a branding and marketing company, but there's never a rush to sit down with those in the medical field and ask, hey, what are you guys not doing? Mm-hmm. Does that make sense? Mm-hmm. There's always this, we need to market it and brand it, but there's never are we doing the thing we're doing right now? Like, we're not, I don't think there's enough questions on what it is that we're doing. Because and it comes back to the liability word. It comes when people ask, are we doing the right thing? I feel they're more asking, hey, we could not get sued for this, so we're okay, right? Mm-hmm. And it's like the right thing exists outside of what you've been taught. What you've been taught is the gear that you need to explore, but you're supposed to find new techniques or what works and share that with people and understand it may not work for them, but they should be willing to start thinking outside the box like you do to help someone.
Because people don't like change.
Yeah.
I use this example all the time. Mm-hmm. We here. We sitting here among this amazing little setup I love. With all this technology,
put a lot of work
lights and shoes and pictures, and it's very creative.
All the sneakers.
That's why I feel really energized in here, right? It's creative in here. I guess my creative juice is going. Mm-hmm. But own this space, well, you rent the space or whatever, but you're paying for this space, you're paying for utilities, you making sure you're getting your bills paid off, stuff like that. Paying my bills, this, that, and third. We have normalized how tough it is to just exist and live.
Yeah.
So sometimes when people see it, right, it's just like, oh, well, that's just life. That's, oh, well, just gotta do what you gotta do. Like, I hate that sometimes. Like, you gotta do what you gotta do. This is hard. Everybody can't just be, susceptible to saying, I am doing a great job at paying my bills and just living, paying for high gas. Gas is $4.80 something a gallon. Groceries is overpriced. The internet is overpriced. The streaming is overpriced. Everything is super inflated. Mm-hmm. And then salaries don't match that.
Yeah.
Right?
Yeah.
So you talk about suicide prevention, and just to exist and to live is difficult. But somehow we have changed that narrative and saying, well, you just got to do what you got to do. That is suicide prevention. You saying that, it's not going to be helpful to somebody who feels like they are drowning.
3 things you shouldn't say to someone struggling with suicide. Go ahead.
Again?
You go first. Oh. Now you go first. We didn't record that one.
You got to do what you got to do.
Mm-hmm. That's number 1.
You got so much to live for.
Mm-hmm. It's number 2.
Is life that hard?
All right. Now break down why for each one.
Mm-hmm. So do what you got to do is to me is really limiting. Mm-hmm. Right? Because I am doing what I got to do, but I still can't get over the hump.
I think to add to that, you just got to do what you got to do. Me reaching out to you to tell you I need help and I'm struggling with suicidal thoughts was me doing what I needed to do.
Right.
And you told me to find the answer when I thought you told me you'd have my back. And sometimes finding the answer is reaching out to someone who's not in the problem to help me. Mm-hmm. That's like someone saying I have a problem and you looking them dead in the eyes and saying you are the problem. Mm-hmm. Mm-hmm. That's what that does.
Mm-hmm. Yeah.
And when those people leave on the podium and at their funerals, it becomes I tried so hard in terms of the person who's like, I tried so hard. And it's like, unpopular opinion. what you thought was effort was you deflecting your inability to help your friend or your loved one.
What's that guilt and liability again?
Yeah.
Personal liability, personal guilt. Right? I don't want to be responsible for this person who's dealing with that.
Yeah.
You feel what I'm saying?
Yeah.
And it's just like, but that's your homie. That's your friend. That's your loved one. Right? So if that's what you call them, you technically are somewhat responsible in the sense if they're asking for help.
You're your brother's keeper.
Yeah. If you say that, right? That's what you believe. So yeah, now you make a great point about that. What was the second one I said? You have so much to live for. Right?
Top of the key, said this to my boy that I was talking to that I told you about.
Yeah.
You know how they say one's man's trash is another man's treasure?
Yeah.
You have so much to live for. No, I don't. I just told you I have suicidal ideations and I don't want to be here. That's when one man's treasure becomes another man's trash.
Right.
You think I have so much to live for. I'm telling you this is too much and I no longer want to live.
Right.
I'm telling you the truth that I'm existing in, that I see, that I smell every day I wake up. And you're telling me, nah, but you're a liar because look at all the beautiful things. And it's like, what do all the beautiful things have to do with me?
Right. I don't see them as beautiful.
Yeah.
I don't think they're beautiful.
It's just another thing that is burdensome. It's another thing that I'd rather just not exist to have to experience this.
To have to deal with it.
Yeah.
Yeah.
And if your only answer is you have so much to live for, I just sometimes want to ask those people, did you really think about what the person's going through? Or did you just regurgitate what you've heard in church? Did you regurgitate what your parents have had to tell you for you to get over the hump? Because those words aren't always correct. A lot of us aren't self-aware enough to realize that great piece of advice I needed when I was down doesn't count for the person whose foot's halfway out the door. If anything, that just gives them a nudge.
Yeah. No,
that makes them get more quiet, and then they realize maybe I am right because I'm the one thinking of these things and you guys can't see it.
Exactly. And it goes back to what we said earlier. People don't know what to say sometimes in those situations.
Yeah.
But they know they have to say something. So I'm gonna just say whatever pops up that I think is right. Been told to say things like that. What do I say? How do I do? And it's okay to not know what to say, but it's even better to support. Hey, I'm here for you.
Yeah.
What do you need from me? Right? If you just need me to sit with you. Sit with you. We ain't gotta talk. We just sit. If you need me to hear you out. But don't go in there. You've personalized it because of your own guilt and liability. Personal guilt and liability.
Yeah.
Yeah. What was the third one I said? I said, don't.
Yeah, so much to live for.
Have so much to live for. Just gotta do what you gotta do.
Gotta do what you gotta do.
And
you said third one.
What's the third one?
I got the film. You don't want to say. Yeah, it's all you.
I don't forgot that quick.
I mean, there's more. There's more statements that people have said that it's just like, why would you say that?
Family members love you, or we love you so much, or
love has nothing to do with someone who's suicidal. And it's funny because I'm asking you these questions, but it's like I'm telling you from my perspective as the advocate that has been dealing with a lot of people that are struggling with suicide or spiraling.
No, that's good. I think this is a good back and forth for people. I love it.
Love is what's in the room when the danger is over. You feel what I'm saying? Love is encouragement. Love is the house, but a person needs a shower, they need food, and they need space to think about what they're gonna do. That's what decompressing is, right? And when you throw love at someone who is suicidal or in the middle of a bout, what you're saying is, you remember how, this is a talk you and I had personally, and I said I have a problem with dating people right now because I don't want someone to think that saying to me, but I love you, changes the fact that there's a problem in the room. love isn't a band-aid. Love isn't bandages. Sometimes love is the poison that's blocking the way of actually handling what's going on.
Yeah.
And that's what, unfortunately, a lot of people do. I love you so much. How could you do this to me? Well, when your significant other or the person you believed in was complaining to you about how happy they were, well, how not happy they were, when they were telling you that things just don't feel right anymore, when they were expressing to you that I don't know what it is, but I can't shake this feeling that things aren't getting better, you didn't listen to them. You were just happy that they're currently not the problem. And that is the biggest issue that I see when it comes to suicidal ideations. We are so obsessed with things no longer being a problem. When they stop being a problem, we all stop working collectively.
Yeah.
We only work in the emergency.
We also only work just because we want to fix.
We work when the shots are fired. We never ask, how did the bullets get there? How did the guns get there? Who got the weapon? Who sold the weapon to who? Why was the weapon used?
It's reactionary to everything. Well, that's the whole healthcare field.
And not only, but that's not just the healthcare field. That's also the at-home field. That's also the in-life field.
Yeah, yeah.
So what we do is, it's not emergency unless you need a Band-Aid. You should have better knives that don't cut people. It's not an emergency unless you have to change the tire because now it's flat. You knew about the nail in the tire 5 days ago.
Yeah, tire bending.
Yeah, you feel what I'm saying? It's not an issue when the lights are off. You knew you stopped paying your bill 4 months ago.
Yeah.
Or you knew the person stopped paying the bill 4 months ago.
Yeah, out of sight, out of mind. But I think that's a mindset that we all have embodied, where we don't take the time to engage with that, right? One of the things is, I was reading one of his books that talking about nonviolent communication. I know there's some, everybody has discrepancies around that, but one of the things I pulled out of it was about we observe and then we also assess. So we usually assess, right, instead of observing the behavior, point out the observing of the behavior. Right, so before and how the example I've used it was you walking around and you sad, right, or you just down, or you just whatever, and it's like, oh, well, Juice, you look sad today. You must be depressed.
It's a big leap,
right? And we assuming, but we also assessing that person instead of saying, hey, Juice, you've been looking down all the time. Been looking down the last couple of days I've seen you. Is everything okay? Right? That's different than saying, oh, well, you look sad, you must be depressed. I never said any of that. But by saying that, right, that makes it super violent. So now you're going to maybe not say anything at all. Yeah. You might be going through something.
Yeah, that's it.
Or I'm not saying that, or I'm going to just blast off on you. You know what I'm saying? So, again, we in a hustle, bustle society. I've said it all the time. So it's very difficult for us. That's what one of the, outside of everything else that happened in the pandemic, right? One of the things that I felt like was the kind of a pro to the pandemic, where it made us slow down to think about what are we doing? We're moving like robots. Yeah. And then we're wondering why things are deteriorating, relationships not working out, or we're not happy. Right, because you've just been moving like a robot.
We became professional at avoiding the issues.
Yeah, out of sight, out of mind. Because if it's not in my front door, I ain't got to worry about it. Yeah. But it's piling up in the back, in the garage, in the basement.
Yeah, but that's in the garage. That's in the basement. I don't hang out there.
Yeah, I just got to go through there once, twice, and I get to it later.
I'll be fine.
Yeah. Yeah. And you get to it, but to get to it later is 1 year, 2 year, 3 year, 4 year, 5 year, and now you're trying to figure out where all this baggage is coming from.
Or why there's a brush fire in your basement.
Right. Or why there's a snake in the basement. Yeah. Or, a mouse in the basement, something like that. Lord forbid, please don't have a snake in the basement. Yeah,
He said, I am fearful, Lord.
Fearful of snakes. But, just, I really think, and we've been, you think about, just kind of how we went through school and college, we were made to be like that. Yeah. We were made to be robotic. Right? Out of sight, out of mind. Yeah. When a crisis pops up. But, again, we got to do routine maintenance on a car. If you don't change the oil for the whole lifetime of your car, guess what? You don't change the tire, change the brakes, guess what? It's not going to run.
Street story for you. Back in my days when I used to run Velvet and a whole bunch of other establishments, I used to work with a bunch of various managers and doormen in the city of DC, right? And one time, this dude was yelling because this guy hit this lady, right? Now, context, the two women was assaulting this one guy, and it started because that one guy was arguing with another guy who was with the two group of women.
Right.
So him and the guy fought twice, meaning they fought, took a break, came back and fight again, right?
Long night.
Cool, right? And then after that, the two women took it upon themselves to fight him also after he was done fighting the guy when he was just chilling, right? And they fought twice. And on the second time, which is the fourth fight, within 20 minutes, he knocked one of the ladies out. Oh, and one of the guys that was working with me was like, "Oh man, you put your hands on a woman. How could you knock her out?" And I said, "Well, we gave this permission to happen." He's like, "What do you mean?" I said, "No one left their establishment or their job, and no one stepped in to break it up when the first fight happened."
Right.
We watched two fights happen between two guys. Then we watched two women assault a guy, him get away, and then they assaulted him again, and he knocked one of them out. I was like, that's what group permission is.
Right. You're
complaining because somebody got knocked out, but no one ever stepped in.
Right.
With the people that I worked with or the people that were there, no one decided to step in. We all watched.
Yeah.
So I was like, the thing you're complaining about, it's not them. We're all guilty of it. That's what that is.
Right. We're complicit in that.
Yeah. And that's what I observe when it comes to suicidal ideations.
Yeah. Right.
They're supposed to be able to have these thoughts. Them having the thoughts to me isn't the bad thing.
No.
How we're handling the thoughts, or them telling us, or how we're not making a space for them, or how we're happy that they're no longer an issue, that is the bigger issue.
You know that those numbers that are there are probably not even really realistic on how many people have had suicidal thoughts.
Oh, definitely. Not even a question. People don't know how to define what is a suicidal ideation. They think a suicidal ideation is when I've become the problem, I'm a part of the number of suicidal ideation. And it's like, no, just having the thought that I wanted to take my life. This just that simple. That's the definition.
Yeah, I
had a thought.
Yeah.
Why did I have a thought? No, you don't have to explain it. Just, I had a thought.
Boom.
That's it. You're in the number.
Right. In the number.
You don't got to report anything. It's you're the number.
Yeah.
You had the thought.
And then you think about how many have actually said that, like reported to the numbers, the statistics piece, but who have not said that either. It's a lot more than you think.
It's high. It's
super high. Super high.
But how many people really reports numbers? And then even the scary thing is, so you want these people to get help, right? And you want them to report when they need the help. 75% of all jobs across the U.S. can't hire someone that has those kind of thoughts. Like, if they find out you have those thoughts, they can figure out ways to let you go from the company because of those thoughts. In the government, there's government programs that they want people to come forward if they have, like, mental illnesses. But a decade ago or less than that, people were getting fired.
Yeah.
For that, and still are. There's still that old way of thinking in a lot of departments in the government.
Yeah.
So when you look at the government side, the state side, or just the ordinary side, we are built on a culture that people can't come out about what they're dealing with when it comes to mental health, because that gives jobs the opportunity to be like, all right, we need to figure out how to get rid of this person. We can't tell them we got rid of them because they kept it honest with them. We got to just find something that works and nitpick it until they want to leave.
Exactly.
And then you can't afford to get help.
Exactly.
So do we want to help them, or are we all just avoiding one very large liability?
And this is why I say it's political.
Yeah.
Because that's a political thing. You know what I'm saying? And again, when you start thinking about, you look at that, we start talking, okay, well, bring some licensed professionals in to do wellness workshops or work contract with some EAB, whatever, not EAB, but...
You mean so the companies can now have a statistical rundown of who has what and keep that in mind for the future?
It's not supposed to.
You know how many companies not supposed to, and they do a real good job of getting rid of those people later?
I know. And I know that's why some don't want to come out and say what they want to say.
They can't.
Some, may not use their insurance.
Medical benefits?
Right.
No. That's why NFL players no longer go to team doctors when they have issue with their bodies, and they go to doctors outside the institution.
Yeah.
That's what it is.
It shows up. I know it shows up in life insurance. Mm-hmm. They ask you those questions, things like that. And so, again, political, right? But I'm saying that I'm going back to the point of saying, like, this could be prevented if you utilize the right resources, but you don't want to because we're not reacting to the crisis.
After you make the change that you have to make or you're going to make on the state and government side, there's going to have to be a whole bunch of big change on the office side and the corporate side and how things are handled. It's just no. And it can't be a fine of just $50. No. We're talking about some serious stuff.
Mental Health America did a report a couple years back of mental health in the workplace, and they reported, they said 63% of all employees report workplace stress.
You see how he be dropping numbers at random places? You see what I mean? Numbers man, that just got old. Dropped. That's old. It's old numbers. That means he has like a binder, a little Rolodex of numbers.
But
What's up?
I worked on that though. Like I years prior before I got into like public speaking, I was like,
so you did research?
I want to be a person that
you
can
did
drop
research,
numbers.
right?
Yeah, I want to be better.
He did research without a doctorate.
Stop. So imagine what I could be doing in the doctorate program.
He said, imagine what I could do.
I'll be cooking
when I get the doctorate. Imagine.
Imagine I'm in the classroom teaching a teacher. Let me do this. Now you wrong. I'm gonna tell you about this. But no, they put that report out there, and so that's why I'm always I'm trying to get into more of the corporate spaces to do employee wellness programs, because that is a major thing. That is a major thing that comes up in my caseload. We talk about, okay, well, what type of topics that guys come in therapy for you seeing? What do you typically see in your practice, right? Relationship.
Yeah.
Communication.
Yeah.
Issues. Sometimes traumatic background. Other one?
Little saison.
Racism, social justice type stuff that, filling that push and narrative there. Employee stress.
What's 3 pieces of advice you'd give to someone who's struggling with a suicidal ideation?
3 pieces of advice?
Yeah.
Make sure you figure out who your support network is, the ones that you can trust with that information, and they will be helpful for you to kind of help guide you through that process. Secondly, develop or reach out to maybe a crisis worker if you're in that place where you need somebody to talk to and somebody's not really following up, or you just feel alone. Reach out to a crisis worker or your therapist if you have that. And then 3, I'm struggling with 3s today. That's my number.
Maybe 2 is all you need.
I'm gonna stay with 2.
What's a piece of advice you'd give to someone who's struggling with a suicidal ideation due to betrayal?
Betrayal from family?
Expectations, family, the people around them. It'd be so simple.
That's a tough one. Because I guess you have to ask the question of, okay, how do we get to this point of feeling betrayed? What was the one thing that I felt betrayed by, right? And is that something that could be fixed, right? And is it something that I need to change? Like we talked about relationships. Is that person even going to be willing to change?
Yeah.
Are they willing to be able to listen to help you process that? Or is it somebody that is resistant, right? That won't even engage with it.
Yeah.
Right. And so the camera. And so is that something that you need to, I guess kind of going back, because you asking this question and it's super, it's loaded, but it's like I don't have that much.
But it's necessary.
But it's necessary. I don't have the context.
Yeah.
Right. If I'm having that thought and it's due to betrayal, first thing I'm going to say is, figure out how you can speak to somebody and process that.
Yeah.
Processing it by yourself is going to be difficult. Right. So I would say, if it's not a supported loved one or somebody you really care about, maybe looking to find a therapist or somebody that you can work with to kind of help process that out. That's something that I don't know if I would recommend doing by yourself because there's so many layers there. And you getting stuck, if you're already there feeling that way, it's going to be hard to kind of work yourself out of it by yourself.
Yeah.
So I would recommend seeking out help, hotline therapist, somebody that can kind of help you process those thoughts out and work to a plan to make sure that, you know what I'm saying, you're safe, but also this is why I feel the way I feel. This is where it's coming from.
Yeah.
Is this person capable? Yes or no? And then can process it out.
Yeah.
Because I get, when you're asking those questions, I get a little answer because I don't want to provide people.
You don't want someone to take this advice and be like, this is what we got to do.
Yeah, this is what we got to do. Yeah,
but you're speaking from... And I tell people, hey, if you don't have an answer, give us your concerns.
Yeah.
That paints the picture better.
Right. But just, you know, don't know where that person is at.
Yeah. You never know where they're at.
You never know where they're at. So you can say it, but then I don't know if you had a plan. I don't know if you intended. I don't know the severity. Right? So if I say what I say, that might not be enough.
Yeah.
You know? So I'm gonna lean back and kind of say, you know, reach out to somebody that's a therapist or a mental professional to help you process those thoughts.
I think, you warned me that when I started this work, people are going to start looking to me for advice on. I don't think suicide should be considered the only mental health emergency. I think the mental health emergency is when things have shifted for someone. That's how I view it.
Yeah.
You feel me? Society views, hey, they're about to take their life. It's an emergency. No, it was an emergency way before that.
Yeah.
When they were talking to you and things were getting
that was the first emergency.
When they told you they don't feel right, when you think they may have been crying and you ignored it, when you can see they've becoming more angry than usual, you're already in the emergency. And a lot of us make the mistake of thinking the emergency is only an emergency if there's a life on the line.
Yes.
But an emergency is an emergency when normalcy has changed.
Yes.
And we're all just adapting to the change instead of taking time with the person if you care about them enough. And not a lot of us ask, hey man, if this wasn't an emergency, would we care about what's going on in this person's life? Just be honest. Like don't lie for me. I already don't give a fuck when I come in a room, but I learn to care about these people as I come into their lives.
Because you don't know. We've talked about all the time. You don't know where they're at.
We don't.
Or what's going on that day. So that could have been the catalyst, right? And that's why I said treating people in a certain way to make sure, because that's going to go a long way. Right. And I also bring up the quality of life and the affordability of life. Yeah. Because that could be the catalyst to spark off what's going on. So if you talk about, okay, if I feel betrayed by my career, betrayed by my personal endeavors, betrayed by the bills and the economy, I can't really give something to that. Yeah. Right. Because of what's going on. Right. I can't really tell you a treatment plan around that, but I can help you flush out and process those thoughts. Yeah. And so the thing is that, you know, we really have to be more intentional with each other. And compassionate. Yeah. And stop.
Real compassion.
Huh?
Real compassion.
Real compassion, not fake compassion.
Like not just you have me from 5 to 6 talk. And that's it. Only the 5 to 6. Yeah. They came at you at 6:05. You was like, nah, you had me at 5 to 6. I don't know what to tell you. That's crazy. Yeah. My 5 to 6 is done.
We got to check, we have to check in more often. We have to, you know,
redefine the check-in. Redefine the check-in.
Redefine it?
Yeah, no, check-in needs to be redefined. Yeah. People think check-in is just asking, hey, how are you? My boss at one of my jobs one time, who I haven't talked to for 2 months, asked me how I'm doing. And I gave him the usual response, and then he just stared at me. And I said, oh, you really want to know how I'm doing? He said, yeah. I said, we've been practicing not doing this for 2 months, so excuse me if I didn't get that right the first time.
But some people won't. They'll just say I'm good, but not be really good. And some people also are not in a position to even process what that person is going on, and they don't even want to hear it. They just say it to be saying it. And so,
or there's a risk.
Or there's a risk.
I tell you the truth, and all of a sudden, my hours start getting less. You're starting to tell me I need to make hours for things, but I know I need money to get things done. So you lessening my hours and you making that decision without my permission doesn't help me in what I have going on.
Right. risk, liability. It's just it kind of go back and forth, man.
Nah, it is, man. I once accidentally, purposefully came up with a solution for someone who is dealing with this currently. And her and I, we sat down. I did a whole video about it. Her and I, we sat down. She told me about everything that's going on, and she was telling me about her expectations and where she would be right now. And she never told me that she was having those thoughts, but my friend called me up and told me she was having those thoughts. And I was like, cool. Sat down. She didn't know me from a can of paint. I said, hey, look, you don't know me. You don't need to know me. You don't need to believe me, but I believe in you.
Yeah.
Because my friend knows you, and they speak for you, and I've met you now. So she told me what was going on. I said, let's do this. I was like, what were the 3 things that made you happy when you were younger? She told me the 3 things. We made the list. I said, okay, that's dope, that's dope, that's dope. I said, okay, tell me about your life now. Tell me about her life now. And I said, you realize all the things that used to make you happy are not in your life right now, right?
Oh my God.
And she said, yeah. And I said, okay. Now, what are we going to do to reintroduce the things that make you happy and bring you joy back into your life? So she said, this, and this. I said, all right, so every week when I see you, I'm going to ask you about one of these things. And we're going to make action items to set these things up, whether it's dinner with people that you love, video games, or just working out. And every time you do it, I'm going to congratulate you. But when you don't, I'm not going to congratulate you. I'm just going to simply say, well, there's always tomorrow, and I'll be here tomorrow, so we get to talk about it when you do it. And since then, she's accomplished everything on her action items. I see the color in her skin getting better. Her partner told me they've been doing a great job. And I mean, they're redecorating the house. And I was like, what you were struggling with is real, but you do have to acknowledge what actions are you not taking to help yourself.
Yeah.
And it's your responsibility to bring and reintroduce joy into your life. And only you can do that for yourself.
Yeah.
But hopefully you have the right people around you.
Environment matters, community matters, intentionality matters, and to see, I'm gonna tell you again, like I'm gonna tell y'all, and hopefully the people see this video gonna tell you the same thing. That was all social work and therapist, but you know what I'm saying?
He said, hey man, your boy needs to just be hired, okay?
That's something that I utilize. I mean, touch it like that. I'm sorry.
No, you good. We boys. We boys.
See, I'm
worried now? You think I'm worried now? Come on. We broke bread on the couch, man. Stop playing.
One of the things I used to do when I was working in inpatient was a car group, and I would ask guys in there, and I got these people in here are pretty much, just, suicidal, homicidal, not taking care of themselves or whatever's going on, right?
Yeah.
And on the board, we'll do this car group, which is now my mindfulness group that I do now, session that I do with my clients. And I will write on the board, we'll talk about the cars, and I want you to describe the car. What feeling does it elicit, right? Name 1, 2, 3 of them. Get on the board, boom. And then I come back and I say, do any of us have these feelings right now, right? And of course, in the inpatient, like, nah, I don't. Some be like, oh, yeah, I might do, but this is what's going on. And I was like, when did that stop? And walk them back, right? And they're like, okay, stop, we're in here. So, okay, how can we develop a plan to get back? So, you just put that in practice in a sense.
What's that technique called?
I don't know.
These technique has names.
But I would really, I would probably say that's more. It could be a little bit CBT. It was CBT-ish when I started it.
What does CBT stand for?
Cognitive behavioral therapy. So getting in touch with your thoughts, feelings, and emotions, right? And how they connected. As I know, everybody, all the therapists is like, that's too generic. It's too simple.
Oh my God.
Okay, man, but listen.
That's what we're working with right
now. It's a good start.
Yeah.
Now, do I think I have incorporated into the mindfulness aspect, which is the act of being present and working with black men so they can connect mind and body and feeling. So they know if I'm stressed out, I can feel it in my, I tend to feel it in my stomach. Yeah. I tend to feel it in my chest, tend to feel it in my shoulders and stuff like that. And so I've connected to a more somatic experience with the mind-body connection. So that's a little bit more of a dialectical behavior therapy intervention and mindfulness intervention as well. But you just did pretty much practice that on your own. So that's why you should probably be a social worker.
He says so full circle of this whole conversation. Since we're here right now.
Yeah. But then even, I think I'm gonna kind of going back, the intervention that you, like with working with that client, right? That's going to, I mean, a person that's going to come up a lot as an advocate. But then again, you see how nuanced and kind of layered that was when addressing that. She had that thought, and then what was going on? Loss of happiness, loss of these activities. How can we get those back? You know what I'm saying? When you asked that question earlier, how can somebody deal with something like that? That's a nice little plan, but that is just more detailed than just, hey, just do this.
And you know, it's unpopular, but I understand when people decide to go when there's no more joy in the room for them. I get it. Like most people are like, no, that's bad. You shouldn't get it. That should never be a good thing. I didn't say it's a good thing. We're saying we understand why these decisions are made, and we understand why some folks would feel not feeling anything or existing would be better than what's going on. But we also take it as our personal job to stand in the way of that while better understanding the person and what they're going through. And one of the dudes who's going through it, I was like, hey man, I just want to let you know I love you. So what? I was like, no, I love you. I was like, you don't got to say it back. It's not forced. I was like, I need you to understand that within our friendship that we developed before I found this out about you, I've always made it a point to let you know that
That's why I was like, 'cause I asked them, I said, oh, so y'all cool with me still doing my side stuff?
Yeah.
They was like, nah, like, do it. That's gonna make us look good. And I was like, you show. Because every place I've worked in social work, and I've heard horror stories from academia, they don't like that.
Yeah.
You know?
Do you think certain academic programs are changing, or they would like to change?
I think they would like to change, but it depends on, like you said, leadership. And I just think that I'm in a good leadership position.
Okay.
With the folks that I got, you know, that wants to see change. And if we're not evolving or promoting change, then they're gonna feel away. Everybody's not like that.
Yeah.
You know what I'm saying? I've never came to
like that.
Yeah, I've never came to a situation where it's like, oh nah, yeah, bring it, whatever you thinking, whatever, you know. Really? Because I got some stuff, and they're open to that. So
is that scary though? Do you ever, in that position? We'll keep this part in. In that position, do you ever feel sometimes the other shoe may drop eventually?
What you mean?
Like, you remember how you said right now you're shutting down your practice in September, right? And what you're doing is you're cultivating the newer generation of students that are going to come out and be therapists. And it's like, do you think this safe space will last for a limited time, or where you are should be fine for the work that you plan on accomplishing for like the next 4 to 5 years?
I'm hoping that it will be, for that 4 to 5 years. I hope that we'll be able to cultivate a space for those new social workers to know that, one, they're wanted in the field, they can do this work, they can be what they want to be, and here is what we want to prepare you for to do once you leave. You know, and so my hope is that in that 4 or 5 year time frame, even 10 years, even when, you know, whatever happens down the road, that's still there. I know everybody's not the same on intention behind that, but it feels like, to me at least, this department of staff is like, we want to create well-rounded, holistic social workers that can get everything they need to get before they get out into the space, because we all went through it. And these are the limitations.
Yeah.
So let's address those limitations before they even get out there.
Are you allowed to say what school you work for?
Yeah.
Okay.
Yeah.
Okay.
Yeah.
What school you work for?
Virginia State University.
Okay. When it comes to this newer generation of therapists that you guys are creating right now,
Social workers and therapists.
Social workers and therapists. All right, so that's funny. When what's the difference between a counselor, a social worker, and a therapist? It's a very specific reason I asked this question.
That question comes up all the time.
Yeah.
Because it's used so interchangeably.
Yeah, and it's like, it's annoying to me as a consumer, because it's like, I had to educate myself and put the right people around me to learn this stuff. And most people aren't really going to answer those questions in detail. They're usually just going to answer, all right, that's good enough, I'm going to go now, before they ask me anything else.
It's funny, and hopefully I'm going to answer that in a way that makes sense and that everybody can grasp. Like, so you got counseling, social work, and a therapist, right? The disciplines are different, right? So we have social work discipline, we have counselors or licensed mental health professionals, right? Licensed professional counselors, LPCs, and then we have marriage and family therapists, right? So these different disciplines, psychologists, right? Clinical psychologists, counseling psychologists.
And each one of these counts as a different form of therapist?
Yes, I'm gonna get to that.
Okay.
So each one is a different form of discipline, right? And it's pretty much how we are educated on how we are taught, right? All those disciplines, though, you can become a practicing therapist.
Okay.
That provides individual psychotherapy or group therapy to individuals or groups.
Are those the foundations for people who usually become therapists? They start there and then they become a therapist with a focus in this?
Yes, typically. But it just depends on the population. Like, typically your LMFTs, your licensed marriage and family therapists, will do...
That's a mouthful.
Yeah, I always had to slow it down. But they typically might do marriage and family therapy. But that's not to say a social worker won't do the same thing.
Yeah.
Right? It's just how those disciplines are how you're taught and how you engage with the person. So for social work, right, we look at person and environment and how the environment also affects the whole person. When we go to therapy and become a therapist or licensed therapist, right, then we can use that based upon our education, our discipline, to help provide therapy, but also look at that whole person and environment. I'm not to say that every other discipline don't do that.
This is your camera if you ever want to talk shit or like you got something to say.
Okay.
Yeah, to the population.
Got you. It's not to say y'all don't, other discipline doesn't do that, but for social work, we're taught that way, right? Yeah. Versus maybe a clinical psychologist might be looking at more so, they're looking at symptomology, or different issues, mental illnesses, or things going on. And so maybe their practice, when they start their therapy practice, might be more assessment related and some therapy as well. Yeah. So it's just different disciplines, different ways to be educated and taught, and then your approach on how you get there to be, a therapist or whatever you want to be in that space. Counseling, anybody can do counseling. Right, okay. In a sense.
So an average person can become a counselor without the credentials?
It depends on what the credential discipline is. Like you can be a career counselor, right? But that's not providing therapy.
Yeah. You focus on careers and telling people what would be the best path to that career.
Exactly. Yeah. Pastoral counseling, right? That's not therapy. That's counseling.
How do you become a pastor at a church?
Yeah, becoming a pastor at a church and, things like that. So counseling is more of an overall broader spectrum where, certain disciplines, you go into business counseling in a sense, or just, things like that is more broad and specific. And then when you attach some of those disciplines to it, then it turns into the therapy piece or counseling piece or whatever. But sometimes people use therapy and counseling intermediate, and it's just like, hey, guys, it can be separate, it can be the same. But typically, we think about therapy, we are working on your issues, traumas, emotional issues, mood issues, things like that. Counseling might be overall general. Yeah. And seeing how we can guide you to the best place. Therapy gets more specific.
Okay.
Yeah.
So, when someone says they're a therapist, can you be a therapist without a focus, or you should have a focus as a therapist?
Yeah, I get that question a lot. You can be a therapist out of focus, but it just also really depends on. So you asking me these questions, I get super detailed about stuff.
I mean, that's what these cameras are for.
I know,
because you get to talk, and like I think I was talking to someone about this because they were like, why do you do what you do? Yeah. I actually, let me share a story with you. Funny story. So, this young man from Flint, Michigan reached out to me on TikTok for the content that I've been making, right?
Right.
And I sat down and I talked to him, and he was like, I just had a leg surgery, been going through a lot, growing as a person. He's in his late 20s right now, told me about a relationship he got out of, and he was like, he wants to create a similar environment of what I've done for Get Home Safe for him and his homies, but right now just want to start with him and see if this is something he'd be into, and he wanted to pick my brain. So I was like, I just want to let you know, I'm not a licensed therapist. I'm an advocate. So I connect people with therapists. I connect people with folks who do wellness stuff.
Right.
And I share people's stories. But each person I work with, they have an opportunity to share their story. And whether I've worked with you or not, you can reach out to me and we'll see if you're qualified to share your story on the platform, because I have this rule that I don't let you share your story if you're in the middle of whatever's going on and it's something that could be detrimental to how you function in your life right now.
Okay.
Because I would hate for you to tell your story, and you telling your story and your truth is what leads to self-harm for yourself because of that exposure.
Makes sense.
Right?
Makes sense.
And those are things that I got to keep in mind. And most people would be like, oh, so that's specifically with folks with SI. And it's like, no, that's actually for everybody across the board. Yeah. You don't know until you've had the talk and you had to ask questions. And then you kind of get a really good feel for who's what, depending on the situation, right? And he was like, how have you learned so many things? Because you sound like you have a wealth of experience, and I don't think I have a wealth of experience, but compared to an ordinary person, I've done more in this circle of things. Right. And I told him, I was like, well, I learned this from being wrong. So each opportunity I have in an interview, I get to learn whether I'm wrong, I get to learn whether I'm right, I get to learn oh, I need to grow in this area or do a little bit more research.
Right.
Especially when you're directly hearing the story of what the person is going through. Because like when it comes to medication that folks get or therapy that folks get, at the end of the day, and correct me if I'm wrong, the client dictates whether the process is working for them or not. That doesn't mean the process is wrong, but that does mean that there's an opportunity to tweak things and figure out what would someone in this situation need, but that doesn't mean someone else in that similar situation would benefit from the choice that past client makes.
Right. Absolutely. It's always moves on the client.
Yeah.
Yeah.
And it's like, everyone's threshold and everyone's need and digestion is different. It's just like when we were doing the Total Truth event that you saw me doing in terms of creating vulnerable spaces for men. I told the men in the very first event to share with us what vulnerability looked like for them. And I let them know, it's like, hey, there's a good opportunity that like vulnerability is going to look different for everybody, because vulnerability is going to be defined by what you lacked in your life growing up. That's just what it is. I was like, it bleeds into stuff and you may not connect it now and you may not see it now, but after this convo and after everyone's answers, you're going to sit in your car, sit at home, or sit in a park bench somewhere, and you're going to realize, ah, damn, he was right.
Yeah, makes sense. Now, vulnerability, I love that space that y'all are doing that, man. That's a good space. I really believe in that model with working with men, especially black men as well.
I appreciate you. I can tell you the pros and cons of that space too. But with that being said, when it comes to this work and giving out advice, I try not to give advice.
Yeah.
I try to tell folks like, hey, if you want to share your story, that's cool. If you want to talk, that's cool. But like, the advice I give you isn't the solution. It's a suggestion, and you dictate whether it's a good fit for you or not.
Yeah, because that can come back to bite you, and especially
it will.
Yeah,
It has.
especially if you're not, That's why they always say with therapists, like, oh, we don't give advice. You know what I'm saying? But there might be times we might suggest, but it's up to you to make that decision.
And that's why I let folks know you're here to make mistakes. You learn from making mistakes.
Yeah.
Now you may lose some things, but like what you've learned, depending on who you are, could be more valuable than what you've lost. Like you need lost in order to learn. Yeah,
you have to, like, if you want to grow and learn, you have to be able to be vulnerable enough to say, okay, I don't know this, or I messed up on this. And I might say some stuff when I might not be truly correct. But I think sometimes we don't give enough space for people to even say that or be wrong, because because maybe the feedback, or somebody's going to think this about me, or they're going to crush me on social media. And I think that's where people don't want to, figure out, I don't want to be wrong. I want to be always right all the time.
Yeah.
Instead of just allowing yourself to be wrong so you can learn and grow, But that's I want to come back to that question that, though, you said about the specialty or the focus, though, for therapists.
In terms of a therapist, are you allowed to be a therapist without having a specialty?
Yeah. So, you don't have to have a specialty right off, right? But
Right off.
Let's
talk about the beginning.
Because the beginning, you starting out, you have a generalized, pretty much a space of what you want to work with and who you want to work with population wise, what type of interventions you want to use, things like that. And you're just getting your feet wet in a sense. Now, it depends on where you want to go. That's why I say you can be general the whole entire time and be cool, right? And when you first start out, you probably do want to be general. But if you say, okay, I do want to work with this population and provide this intervention, then as you continue to do therapy, you get more specialized in that area. And that helps with marketing, clients, things like that, and building your brand and your business. So it really depends on what trajectory you're trying to go in your career. So that's from a marketing perspective. But when you first start out as a therapist, generalize.
Yeah.
You need to work with everybody in a sense. You can be specialized if you want to and start developing that process. But typically, there's nothing wrong with having a general focus initially.
What would you say are 3 positive characteristics of a therapist?
Positive characteristics? I would say that I'm trying to work on not saying so I came in here today to say that. But
that's fine.
So say it again. Say it again.
You're a work in progress.
I'm working on it, boy. I'm working on it.
In progress.
Yeah, so 3 positive characteristics of a therapist. Openness. Willing to be open and also collaborate with the client
Okay.
on the treatment plan.
What would collaboration, how do you define collaboration as a therapist?
I would define it as I'm working with you on your goals for treatment, and I'm not just infusing all of my evidence-based knowledge, schooling to say, okay, well, no, we have to do it this way, this because this is what this intervention said. This would no. I will work with you and say, okay, this is what I'm thinking. How do you think about? What do you think about this? Mm-hmm. Does this work for you? Or tell me something that you want to work on. Mm-hmm. Back and forth collaboration.
Yeah.
So that's what I would define it as, the collaborative effort to work on the therapeutic rapport, healing, the treatment plan. Where are we trying to go? It's a collective effort versus just I'm in the position of power as therapist, so I have to make all the decisions for you when you're the expert of your life. So I don't know anything about you. Mm-hmm. I'm trying to help you work through those things.
Yeah.
Openness. I'm gonna say. The second one would be a kind of a three-prong approach, but and it's one of the models that I live by, if your therapist is not helping, especially working with black men, black women, therapist is not building trust, safety, and rapport, right? If they're not building that within those sessions, virtually or in person, then that's a problem.
What's you got to detail trust, safety, and rapport, and what examples of that are?
So trust, in a sense, would be me. I am able to know that you are, an expert in your field, and you're not going to steer me the wrong way, or you're open enough to make mistakes, and I can accept that. But at the same time, I'm trusting you with my deepest, darkest secrets that you will help me, lead me along the right path, right? Safety is providing an environment that is safe for me to be my authentic, vulnerable self, and a place where I don't feel like I'm gonna be at harm, whether it be physically, mentally, or spiritually, in those spaces, whether that be virtually or in person. Rapport is me building that therapeutic alliance with the client and the therapist to create a safe and healing place and process. So those three-prong approaches, I think, are super important for therapy, in the therapy space, and I think it's super important, especially for us as black men and black women clients. And so those are my three-prong for the two. And
could you repeat what the two was?
The two?
Yeah, for the folks.
Oh, for the second. So the second one with the three-prong approach for the second priority, I think, is trust. Trust that your therapist should be establishing trust, safety, and rapport.
Okay.
Yeah. And third, even though the openness is kind of making the mistakes, but I'll say with the third one. That kind of extra one caught everybody. Openness, trust, safety, rapport, and I don't know.
I think if I were to interject and say with the third one, I'd say the third one is being willing to clean up your messes when a mess is made, but doing it correctly.
See, I was going there.
Yeah.
But I thought maybe...
I think people are afraid to say that.
Put it in the openness piece, right?
Being a therapist and being someone who helps people doesn't mean mistakes don't get made.
Yeah.
But what you and I have harped on, because we have a lot of conversations about this, is when you make a mistake or you have done wrong by someone unknowingly and knowingly, how do you clean that up? Most people define clean that up as it's no longer a problem. They're not going to talk about it publicly, so it's okay. And it's like, nah, but everything leads back to the relationship.
Yes.
Are you doing right by the relationship you've established with them? And do they understand and recognize your actions that you're trying to do right by what originally this was when it started?
And that can fall in the line of, so it's kind of mixed into the openness and the trust, safety, and rapport piece. Willingness to make mistakes, and like you said, willing to clean that up. What does that look like? Okay, well, if I feel like as a therapist in a session I made a mistake, or I said something out of the way, or I wasn't on my A game as something that's happening in session.
You had 23 clients instead of 16 clients, and that workload may have thrown you off.
Thrown me off.
Yeah.
I didn't take care of myself, or I just didn't communicate effectively, right? I should be able to talk with my client and tell them, hey, apologize about my tardiness, or apologize about my lack of effort, apologize for maybe saying this might have been offensive.
Or being less empathetic this session because of everything I had this week.
Apologize for being distracted, things like that, to enforce that so that you can say that in session. I also think there should be a nice environment where your client should be able to call you out on that.
Yeah.
Right? You know, and it should be no repercussion, right? Your client can say, oh, yeah, you a little bit off today. You look tired today. You know, they can say that, and it could be no detriment to what their treatment is being going forward because they said that.
Yeah.
So it should be no fear of retribution around that. And so I think that's just, you know, so that piece is, you know, willing to clean up their stuff in session and building that environment, because that's what we're here to do. We're here to do work.
Yeah.
You know, so.
Would you say the culture of therapy, there's a culture of therapists who want to work with other therapists or learn from other therapists, and there's a culture that's what I learned through this book is what I do by the book, no matter the situation. Which is hard line. Like, they only follow the book, no matter like the real world experiences they see that are happening that you don't learn in a class. Because I don't think everybody adapts.
Well, that's the problem. That's the problem.
Tell me.
Because the books that we are taught and the interventions that we are used are evidence-based, but most of them are whitewashed, right? And so sometimes they're not inclusive to, you know, black people or people of color, you know, things like that. And so if you work long enough in the field, you understand that, you know, things we were taught in the class usually does not equate to in the actual, you know, in the field sometimes.
Yeah.
Things look different, right? What we see as a crisis by the textbook might not look like that in the hospital setting or in a community setting or aging setting. And so if you're not adapting, and if you're not also, it's hard, I think, to do therapy without bringing that type of stuff in there, because I don't think you can be effective. One of the things that I talked about, I had a training last week or so, talking about working with black men in therapy, and there's this big issue around making therapy political or making the room political in the session, where they feel like, okay, there's no place for that. But how can you say that if that's part of that person's life and journey? So
or that may be a part of their issue.
Or that may be a part of the issue. That may be part of their anxiety. It may be part of their stress, their depression symptoms, things like that, because of they're feeling the weight of oppression and marginalization in the world due to the color of their skin. So to say that, okay, we're not going to talk about it in therapy, but we're going to talk about these other symptoms, you're dismissing one part of the experience of that person. That's not fair.
Yeah.
That's not therapy. That's not therapy.
Yeah.
You know, so because we're here to work on these experiences, these these emotions, these moods, these traumas.
Sometimes
Shortcomings. We want to better ourselves. We want to learn how to navigate stress better. But if that's the source of my stress, who are you to say that this doesn't belong in therapy?
Yeah. Or why don't we acknowledge what I have going on? Because that's, after I leave this session, that's what I'm going back to.
Right. You're going right back into it. You step up every day. And it's one thing that I tell, when I do trainings and conversation in the community around racial equity or social justice, like, I'm a black male therapist, but I'm still a black man at the end of the day. So every day when I walk outside or step outside, right, my family still worries.
What's racial equity?
Racial equity is pretty much the equitable approach of race and identity to having the same access to things, not because of our color of our skin, but because it's not making us inferior due to the color of our skin. So we have equitable approaches, equitable access to life, right, and to basic levels of living, because we are human beings still, right? So, but what does that look like for us as black people or people of color? We have to make it equitable to make sense for us. And when we talk about equity, it's not the same as equality. Equality means that everybody has the same playing field and the same, started from the same place, but we know that that's not the case. Yeah. So how do we make it equitable for people of different races? So
most people are talking about, I'm trying to start at least first or second base, and for us as a culture, we're like, we don't even have uniforms.
Right, exactly. We don't even have a structure. And so how do we make that? So that's where racial equity, I think, comes in, and defining that. Like, how do we have equitable approaches that fit the needs of the people where they are at now, not what we think they should be at because they're just humans or Americans.
No, I got you. Okay, so let's talk a bit about your background.
Okay. All right.
Jump right in.
Okay.
You have a thorough background when it came to emergencies of the SI nature, which stands for suicidal ideations.
Yes.
Right? Now, were suicidal ideations the only emergencies you were dealing with back in that day, or there were more under the umbrella? It was like a bigger umbrella, but that was a big one at the time.
Yeah, depending on which space I was in. If you're talking about crisis work, that was typically, folks who are suicidal, homicidal, or unable to care for themselves, so they didn't have the capacity.
All right, could you define those three for me? I know we're doing a lot of definitions today, but like people need this education.
Yeah. So suicidal, having thoughts about wanting to harm yourself.
Just the thoughts.
Yeah.
It doesn't always have to be action. Sometimes it's just the thoughts.
Yeah. The thoughts. But then we'll go into, the in-depth pieces of why, what does that mean? Homicide, thoughts about wanting to harm somebody else, right? And then capacity, which is like at this point maybe you don't have capacity to take care of yourself and you're suffering mentally due to an illness or maybe sometimes a health condition where you're not able to pretty much practice your activities of daily living.
Would that count as someone who's breaking down and they become almost comatose like state from the mental burden?
Yes.
Yeah.
Yeah, it could be like that sometimes.
Okay.
Yeah. So that was we was doing assessments and doing that for like 3.5 years to see if that person, met criteria for inpatient hospitalization for psychiatric care, or if they needed a lower level of care, which have been crisis stabilization or outpatient treatment, regular therapy services. That was one thing, and then working inpatient for quite some time for two years prior to that. That was more so dealing with folks or individuals who suffering from a mental illness or mental health condition, mainly sometimes from those things we talk about in crisis. And they needed psychiatric care, which typically would last from 3 to 7 days, sometimes up to 30 days, depending on the severity. And then that's where they would stay to get back to on their feet to get care. And that could range from everywhere, any type of mental illness. Yeah.
Okay. Within this work, if the average person were to ask you, hey, what would be 3 steps to handling SI emergency in terms of suicidal ideation, what would your advice to them be?
I guess the question on that would be, if somebody is calling or saying, reaching out saying somebody's having suicidal thoughts.
Like my calls to you.
Right. I tend to say, okay, well, are they in a safe place? Right? Are you with them? And when I talk to people about like the suicidal prevention on that, it's like, okay, well, I want you to be a shoulder to lean on for them. Don't judge them. Helping them process what's going on. Like one of the things you don't want to say in that moment is, would you have so much to live for?
Oh God, I got some stories for you.
Yeah,
keep going.
Yeah, you have so much to live for because in that moment, that's not helpful, right? Because right now I don't feel like living. And this is why. And so, just being supportive, like I'm here for you. I'm here. You want to talk or here, or you want to, what do you need to do? Of course, I don't want to make people into like assessors in those spaces, but also that kind of just making sure, like, do you got a plan? Do you really intend on what's happening? How can I do to help you? What do you need? Do you have a therapist? Can we get you there? Is it something where you want to talk to somebody that's not me? Let's say you settle with a crisis call. So like that's a couple of things you can do. But the biggest thing is support and being there, helping them with them, like what they're going through at that moment. They might say I'm suicidal, but I don't have a plan or intention. I just feel like dying today. That's not really a emergency to say, okay, we're gonna call 911.
But it's a concern.
Right? So why do you feel this way? And let's talk through it. And then we game plan from there. So sometimes that question is kind of hard to answer without context. And I think, and that's in my career now where I'm at, that has been, we talked about it earlier about not giving advice or answering questions. It's hard for me to answer questions without the context or a certain scenario. And then we can kind of walk through when you give me a call, like, okay, you did this, you did that. Okay, go there. So sometimes it changes like that. Yeah.
For example, I had a situation I've been dealing with consistently for like the last month. Young man who's struggling with suicidal ideations, and I try not to be high and mighty. Like I meet them where they are,
right?
Because like
that's a social work skill, by the way.
Is it?
Yeah.
Oh, I see what you did there. But I told him what's going on with you, right? Told me everything in detail. Told me what his struggle is. Told me where the sources of the struggle come from. All right, so now I have an understanding. I know what he's struggling with and everything else. Now, he survived the night. So for me, it's always a 24-hour period. And a lot of folks is like, that's not healthy for me. And it's not. So folks know I just don't answer my phones on certain days, right?
Right.
And what I did was the next day I said, hey, has anything changed? He said, the thoughts are still there, but I'm a little bit better compared to yesterday. I really appreciate you listening. Cool. So instead of bringing back up the problem and everything that he told me, I took the opposite approach of, okay, so what's going on with you? Tell me about your day. Because it's like, a lot of people think that helping people with their suicidal ideations means the suicidal ideation and the thing their friend or their person is struggling with, that needs to be the conversation every time you meet that person. But what that does, unfortunately, is that belittles the value of the person, and instead of you reaching out to help the person, it becomes I'm talking to them because of their suicidal ideation,
right?
Which switches the value of the ideation comes in front of the person, and once you're done with the ideation and they're fine, okay, my job's done here, I'm gonna go now.
Yeah.
And it's like, as a society and a culture, we don't do that good of a job of adding to the value of the people who are there, who are valuable because they're there. They're not valuable because of their problem, and that's it.
Right. But you got to think too.
Yeah.
That person that's thinking about that, right, that's having those thoughts, they don't feel like they will be, worthy enough to be here anymore, right? They feel like they're being a burden.
Yeah.
So when you kind of dismiss that personable experience around, I don't feel like I matter enough, right? Then that should not just prompt the conversation around, okay, well, let me check on them all more reoccurrently because of their suicide ideations and they had these thoughts. No, you should be thinking, I should be checking in on them because I care for that person. And that's my homie, or that's my, my people.
Yeah.
Not just because of these thoughts, right? And I think that's the piece that kind of gets misconstrued, like you said.
Yeah.
Where it's just like, oh, well, I'm just checking on them because you're suicidal, and then once you get calm, I'm good. No.
Yeah, nah.
No.
Because that means when you leave, they're now left alone with the fact that you didn't call for me, you called for my problem.
Right. Yeah.
Which may also reshape the friendship or the relationship you have with that person.
Right. And it also may seem like like you said, feel as if I'm a burden, regardless. You know what I'm saying? Because I have these thoughts, so I'm going through this, and I don't want to bother you with that. But if it's a genuine relationship or approach, might be a little bit different because I can reach out and talk to you.
Yeah.
And have that conversation. You know what I'm saying? Versus just I'm having this conversation at the end of my rope, and you just picking up because of that.
You're just adding more to the rope, but it's just bits and pieces.
Yeah.
You're timing it for, I got you, I got you again, I got you again. And you're not giving the person the tools to discover, oh, this room had other rope the whole time, and it doesn't have to just be this one rope that's burning at two ends.
Yeah.
So the other issue that I see now, and I'm not making it about me, but right now this is what I'm dealing with, is we're having talks about their friendships and their relationships. And, I'm good on that. I'm like, hey, show me a text message of one of their homies that they reached out to about their situation. And their friend was like, man, I can't believe you're bringing this to my doorstep. There's so much to live for. Life is a blessing. And I told him, I was like, honestly, your friend would have been better off saying, I don't really know how to help you.
Yeah.
Because what you're doing is you're deflecting your inability to help the friend, and you're making it about everything that's not the person with the problem. I've never met someone with a suicidal ideation and been like, but your family loves you.
Having a suicidal ideation has nothing to do with whether your family loves you or not.
Right.
Having a suicidal ideation is you're struggling with this concept of life, and you're really struggling with, do I need to be here anymore?
Yeah.
Do I need to be a part of this picture?
Mm-hmm.
It's not always do I deserve to, it's do I want to or do I need to?
I need to. Yeah.
Those two things.
Yeah. I think that's it's sometimes people, I've noticed this, even in times of like mourning or grieving or death, people don't know what to say.
Yeah.
But they feel like they need to say something, so they just say it.
It's because there's a podium there.
Yeah, and it's like, you know what, I gotta say something, but it's like, you know, I I'll leave that conversation alone. But I'll leave the conversation alone. But it's just like, you know, just when somebody brings that to you, you have to be aware of your own fear and biases around that. And people say life is a blessing, but don't live like that.
Yeah.
So why now say that now? I ain't never heard you say that in the first place.
Yeah.
So now you're just saying that to, you know, feel something in because you're scared of this conversation. Which sometimes I think too, therapists, mental professionals are scared of the suicidal conversation too.
Yeah.
So it makes it hard for clients to come and talk to us about suicide or what they're having, and because they're maybe fear that their therapist might not, or mental professional may not be comfortable having that conversation. Or, you know, we might put them in a hospital or something like that. And it's like, it doesn't have to be that.
You move the problem.
Yeah, you move the problem.
You move the problem.
Sometimes that's happened where it's like, you know, we have to hospitalize you, but at the same time, it don't help what's going on. So we talk about suicide prevention, right? It's not just symptomology. It's housing, it's income, it's economy, it's life.
Quality of life,
things like that affect it. You know, if I feel suicidal and I feel like I leave this earth and all these problems, I can't pay my bills and I can't afford to take care of my family. That's a burden. That's something that's real.
Yeah.
Psych hospital not gonna really change that. It's gonna add another bill.
Yeah.
You know what I'm saying? So
like I might as well just jump out the window with this one.
Right.
Yeah.
You know, so it's That's where I think sometimes we get lost in it. We don't think we just jump to symptomology and not looking at the whole totality of the situation.
We stop trying to come up with solutions and we start trying to lean on, well, what's worked for other people in the past. If I say that, at least I gave you an answer.
Yeah.
I think people in general, not just therapists, but like ordinary people that are trying to help, there's a guilt that comes from not having the right answer or a answer. I told you this. And sometimes I told you this or I made a suggestion. It's like, well, I gave you the answer. No, you gave them a answer, not the answer, because you're not willing to work with them. And I think you've heard me say this before, but I really do think that there is, as a culture and a people, we are very much, I'm just glad that's no longer a problem. What's next? There's not a lot of, okay, now that that's no longer a problem, since I love this person or I care about this person, how do we work together to not get back to that place? Like really work together.
Yeah, exactly.
Yeah.
It is because we react to the crisis.
Yeah.
But when it's not a crisis where it could be prevented, it's like, oh, I'm over here with it.
Yeah.
You know, and I think that's where the course of suicide prevention comes in, is understanding how we treat one another, right? Plays a heavy role into that, as far as relationships, where we're going next if that does happen, and how we can best support one another.
Yeah.
It doesn't stop, right? It doesn't stop. And that could be for anybody that says they're suicidal or says they're not. Because you don't really know. You don't know. You know, unless somebody outwardly explains it, says it to you.
Yeah. And my advice is for those who do know. My advice doesn't apply to the person that's hiding the thoughts or hiding the signs so people don't figure it out until it's too late.
Yeah.
And those are two different groups of people. I think everyone likes to throw it in, you were suicidal, didn't see the signs, or we did see the signs, and it's like, no. There's different populations of people when it comes to suicidal ideations. There's the thinkers. There's those who are practicing and they're not sure which way they're going, but they would like to feel something in the process. And sometimes feeling something in the process isn't as simple as cutting. Sometimes it's, do I feel enough pain to make me want to live? Mm-hmm. And a lot of folks don't read it that way, but it's like, nah, that is a thing. That is a concept.
That's good.
And then you have the others who have survived. Mm-hmm. And I actually recently did an interview, because this is all coming out in September, with a young lady who survived a couple attempts. And I think for her case and for other people's cases, because there will always be a survivor, is how do you rebuild life after an attempt? What does that look like?
Yeah,
how do people handle you? How do people learn about you? What are you doing for yourself? Have you had to let people go because they were the wrong person for you? Because you loving me doesn't mean you're right for me. It just means that you love me.
Right.
And you want to see better for me.
Right.
But you may not handle me correctly. You're doing what you think love is, and that's not what that person needs, as someone who survived and now has a completely different aspect on, okay, this is the life I need for myself.
And that's traumatic too. You think about it.
Yeah.
I've survived an attempt to end my life. That's traumatic, right?
Yeah.
I still say it is what it is. I don't care no more. Here's the thing. When you talk about suicide prevention and mental health system and how we deal with this thing.
Yeah.
We always want a solution to this thing.
Yeah.
So when we don't have a solution to it, we get frazzled. But I push back on that, and like, yes, we're experts in this field, and yes, we have the experiences, but these things change person to person, experience to experience. So for all the energy that we're trying to just be able to say, I know it through and through and through, it is unrealistic.
Yeah.
For us as mental health professionals, advocates, therapists, we do not know it all. So I want to say that to the camera as you talk about this and have this conversation. Just because we are in this space or subject matter experts, therapists, mental health professionals, we don't know it all. And we should not strive to know it all.
Yeah, and I don't think the therapy community should strive to paint that they know it all and they have the answers.
Exactly.
Being in the medical field and being someone who cares, or being someone who is paid to care, and it's okay to acknowledge that, that doesn't mean that everything you've learned is always gonna work in a different capacity.
Exactly.
And it's okay to say, I don't know, but here's what we're going to do. People are terrified to say that part. And that's why I think the word and the use of liability has really put a huge constraint. I think that's one of America's downfalls, liability.
Liability. Who
and where it's used and how it's used and how it blocks the things that could be. We can't do that because it's a liability. You didn't say you can't do that because it won't work. You're saying you can't do that because it may open you up to being sued.
Right.
But is it our jobs to save people or to put them in a better position?
Exactly.
Or is it our jobs to protect this place that hires us and make sure they don't get sued?
Yeah. But that's a healthcare problem.
Yeah.
That's a healthcare problem.
Yeah.
And that's above my pay grade, but I still talk about it because we're creating that we created that monster ourselves, thinking that we're these foolproof experts.
Yeah.
You know, and so even with what I say on here today, I might be wrong on some things, or it might lack context and might not give everything right. That doesn't still mean I know it all or what could need to be done in that certain situation, right? Or that experience. I let go the thought of trying to be the expert in it all, right? Or knowing it all. I let that go because that will consume you. Yeah. That opens you up though to just, again, some of that accountability. You keep saying this, you keep saying that. That wasn't the right thing to do. Yeah. So, or that wasn't the necessary conversation or topic that you needed to say in that moment. You didn't know, but you felt like you needed to say something. It is okay to say, I don't know. Yeah. Or it's okay to say, I will get back to you. Yeah. Or it is okay to say, hey, I don't know how to best help you here. Can you tell me what you need or something that you would like for me to do?
Or it's okay to say, this is the best that we can do.
Yeah. Yeah, and it's fine. Yeah. I think people are better or feel better with you saying that. Yeah. But because we have painted this picture as us as being experts, right? Then people expect that. Yeah. So when they come to therapy or when they come to that agency, they expect to get that care just like that, and should change tomorrow.
And it's an expert's job to get it right.
Yeah.
Yeah.
And it's like, but I'm an expert. That doesn't mean I don't make, mistakes, so I don't know about this situation. You know what I'm saying? So yeah. The intervention that you like with working with that client, right? That's going to come up a lot as an advocate. But then again, you see how nuanced and kind of layered that was when addressing that. She had that thought, and then what was going on, loss of happiness, loss of these activities. How can we get those back? You know what I'm saying? When you asked that question earlier, how can somebody deal with something like that? That's a nice little plan, but that is just more detailed than just, hey, just do this.
And it's unpopular, but I understand when people decide to go when there's no more joy in the room for them. I get it. Like, most people are like, no, that's bad. You shouldn't get it. That should never be a good thing. I didn't say it's a good thing. We're saying we understand why these decisions are made, and we understand why some folks would feel not feeling anything or existing would be better than what's going on. But we also take it as our personal job to stand in the way of that while better understanding the person and what they're going through.
Yeah.
And one of the dudes who's going through it, I was like, hey man, I just want to let you know I love you. So what? I was like, no, I love you. I was like, you don't got to say it back. It's not forced. I was like, I need you to understand that within our friendship that we developed before I found this out about you, I've always made it a point to let you know that I hear what you're going through and that I'll take care of you, but I need you to understand what love feels like and that you deserve that and you've earned that a long time ago. So
the other thing I also do is choice. It's one thing that comes up a lot, came up a lot in session, that my brothers they never had choice in their life, and so by me giving them choice, to choose how they want to do this session or what they want to talk about, work on, is the first time they ever experienced that. Choice matters even in suicide prevention as well. I don't feel like I have a choice to do these things that I'm doing or I'm attached to because I'm not fulfilled. I don't feel happy, but everybody's telling me what I should be doing. So I don't even know my own self. Right. So
if you listen to everyone's opinion, you'll never ever figure out who you need to be for yourself.
Exactly. And I may have lost myself. And so, just talking about like suicide and understanding where it's at. And then, even with my book, Refresh the Journey to Find Peace, that's one of the things I do talk about is understanding like how, like, as a mental health professional, as a guy, as somebody that's in the field and space, I've experienced that, and I don't really use it as a talking point all the time, but you get it sometimes why people would just want to leave this world, because of how crazy it is, how tough it is, how rough it is, how hard it is to just exist, take care of a family, and pay your bills, things like that. So definitely understand it.
All right, man. So where can the people find you, buddy?
I'm still on the Instagram as retro_GT. Threads, I guess, retro_GT. I think it's Threads. Okay. And I'm not so much on Twitter as much no more.
I don't know if I'm ever do Threads, honestly. I don't know. It's
okay. It's cool. But yeah.
Is Twitter still popping? I haven't been over there.
I haven't been over there.
Are people still getting like news first over there? This sounds sad, but it just feels much better to be disconnected.
It does.
When a new album drops, it's a new album. I didn't get to see the rollout.
Yeah.
When something happens, you're the last to find out. And that's okay now to be the last to find out.
I'm cool with that, bro.
Yeah.
Like, I think when I took my fast from it, like in June, it helped me kind of self-regulate to kind of just get back to normal and think clear. So I can think, okay, what I need to do with my practice, what I need to do for next to my career. And I was able to see it without seeing, okay, well, this person over here is doing this and this person over here doing that. Oh, there's going to be some guilt because you're leaving your clients or and all that. It's like,
fuck not.
Yeah. No. So
I think I'm Gucci, guys.
Yeah. So I really just mess with LinkedIn and Instagram at this point. That's really just mostly promoting and marketing.
Yeah, no, I got you. And like, I mean, at this point, it's just like, we doing good. Yeah. Honestly, truly, I think we're doing a good job of doing good. My personal profile on Twitter, I accidentally got rid of it. I was trying to change the passwords because I was applying to some jobs, and I was like, you got the email associated with the wrong thing. You should change some stuff.
Right.
And Twitter, which is now called whatever the hell it's called, I'm not saying that name, was like, well, you can't change that. You're going to have to wait a couple of days. And I said, you don't get to stand in the way of my profit when it comes to cloud architecture and all this work that I'm doing. I'd rather just get rid of it. And I got rid of it. And then after 20 days, I looked back at it and I was like, I don't feel any different or sad that I got rid of it. I was like, oh, I didn't care anymore. I was telling myself that you're supposed to care because you've put so much time into this thing. Mm-hmm. But I really do not care anymore. Mm-hmm. I was like, oh, okay, cool. Well, that's a nice little revelation.
Yeah, it's been love, man. I've been off of it. It's on my tablet. I check it periodically, but I don't tweet. It's just nothing that interests me. Mm-hmm. And especially if I start to feel like something is trying to seep in, I just close it, man.
Yeah.
Because I don't feel like that. I do this work 24/7.
Yeah.
So
yeah,
I got enough to seep in and work through. Like I don't want nothing extra. Ain't nobody. It's not really. Ain't the same no more.
It's not. It's not.
Not the same.
He should have never purchased that platform.
Yeah.
It was really fun until he started doing things.
Yeah.
Yeah, but my bad. Where can the people find you? I'm sorry.
Yeah, so IG, LinkedIn is Gary Trey Lights Clinical Social Worker. And really, realistically, just go to my website, www.uphold318.com. Mm-hmm. That's where you can find me, book me for gigs, speed engagements, facilitation. If you want anything related to my book, Refresh the Journey, 5 Pieces on Amazon, Barnes & Noble, Books A Million, and I may have some coming up on refreshvirginia.com website as well, but that's another place you can find me too.
All right, well, this has been another episode of Mental Health Monday. Appreciate you homies for pulling up. We got 2 separate cameras. Peace.
Peace.